And the basic definition of pain, wow, that went a lot faster than I anticipated. All right, so pain, any kind of physical discomfort or sensation. And the idea of pain in Oriental medicine is that pain is due to an impairment in your circulation. Where the saying is, "부통 지통, 통지부통," where things flow, there is health and not pain. Where there is pain, things are not flowing well, and so basically, if all of your fluids of all kinds are circulating well and all of your energy is moving well, you'll be healthy and you won't have pain. And one of the big goals in Oriental medicine is to rebalance the body and improve the circulation so that health improves and pain diminishes. And the ways that you treat pain is you relieve stagnation, so where things are stuck, you get them moving again. Reduce inflammation. The acupuncture itself triggers relaxation. It's kind of one of the nice side effects that you're forced to actually enter a parasympathetic state. And due to that, a lot of people do find they sleep a lot better after treatment as well. And you also get an endorphin release, particularly working with auricular acupuncture, which is in the ears. And some of the methods of treatment for Oriental medicine are acupuncture, which is the needles, auricular, which is treating of the ear, moxa, gua sha, cupping, herbs, and qigong, which are specific exercises.
It is.
Acupuncture. Usage of needles to stimulate a particular response. It's the most flexible and versatile of treatment modalities. You can kind of do anything with it and kind of get at anything with it. This is a picture of a Air Force airman that I treated up in Alaska. And for auricular, as you can see here, you've got a whole bunch of body parts that are projected onto the ear. There's a ton of different maps. And you stimulate the points in the ear with either needles or seeds to trigger a response in the affected area of the body. It's really kind of an amazing thing because you can literally see the difference within a few seconds on a thermal scan of how the circulation is going in the related area. Qigong. These are specific exercises for building health in specific areas, organs, and the entire body. There's 5 basic forms of Qigong, which are standing, sitting, laying down, interactive. An example of that is push hands or sitting. And here are some things that you can actually do already to help yourself avoid pain or reduce it. Cold. Cold creates contraction and worse pain. It's a lot colder this week than it was last week, so you'll tend to feel that you're a little stiffer than you would be in warm weather. So you don't want to actually put ice or eat cold things or expose yourself to cold. It's good to stay warmly dressed. Sorry, no problem. Ice internally or externally creates contraction and slows down circulation. Although you can use ice temporarily for pain, it's going to actually slow down the healing. If you do the recommended amount of icing and ibuprofen for a pain condition, you'll actually get 0 new cell growth until you stop doing that. So it'll actually entirely retard healing on an area if you use ice. Sour foods. The sour flavor has the function of contracting and tightening tendons, ligaments, and muscles, so it can potentially worsen muscle spasms. Not that sour flavor wants to be avoided entirely. It's actually why lemonade's so nice in the summer. Because when you just get that point where you can't stop sweating at all, the sour of the lemon and the lemonade will actually help slow down how much you're sweating. And raw foods, particularly raw vegetables, they're difficult to digest. We've only got 1 stomach, not 5. So a ton of blood and energy has to go to your digestive tract to actually break them down. So if you've already got a muscle spasm, it's going to be worse because you're going to actually starve the muscle of the nutrients it needs while you're trying to break down the raw foods. So if you just lightly cook, saute, break down that cell wall and cellulose, you'll get better bioavailability of the nutrients and prevent a lot of pain. And there's 3 basic stages of injury. The acute stage, which is the first 24 to 48 hours after injury, where it's going to be red, hot, inflamed, and painful. Subacute is 36 hours after to 2 weeks. It's less red, less inflamed, and less painful, but you're starting to have a bit more of mobility issues. And then after 2 weeks, if you haven't done something about this and it's still going on, you can go towards chronic injury. And pain will still be present, the inflammation will be greatly reduced, but there's going to be major mobility problems, and at this point it gets a lot more difficult to work with because it gets a little set in the body. So here are some alternatives to ice. Topical liniments. There's some that are called general purpose blood movers. These are the ones that are going to kind of feel warm and cool Icy Hot, Bengay, some real familiar things, Tiger Balm. And you can use that kind of at any stage and it's not going to do much harm. Cooling liniments. These move blood and energy but have a more cooling nature and are most appropriate in the first two stages of injury and are not generally used after an injury is chronic unless there's active inflammation. Some of these are white flower. This one's really pleasant, smells kind of like spearmint. Dipdajiao, which is fall hit wine. You can use this for big bruises, sprained ankles. And 5 Photos is kind of the brand of Dipdajiao that you can find on Amazon or Google. For any of the small bruises, you'll tend to have it shrink down about 2 to 3 times as fast. And for stage 3 of an injury, this is where it's chronic, stiff, and just kind of aches at you. Warming liniments will be what you're going to tend to use here. And some examples of this are Posamon, which is standard, warm, kind of mild and moderate, really pleasant to use. One of my favorites is Ui oil, mostly because it smells like mint chocolate. It has moxa in it, so this one has a really cool effect because moxa has this very strong transdermal property, where if you put heat over this, the heat will go really deep. Like if you put it on your thigh and then you apply heat there, you'll find that the heat will actually penetrate all the way through the backside of the leg. And hot guai oil, this is awesome for old bone bruises and stub toes that still really hurt. If it's acute, don't use it, but this will actually help that stub toe that's been bugging you for a couple of years to recover. And here's a picture. On the left here is Posamon. In the middle there is Hak Guai, and on the right side there is Ui oil. All right, questions? Sure.
All right, you said not to use ice on injuries. What about a bee sting? Is that?
Actually, bee sting, because it's a venom, which is a protein, it's better to use a little bit of heat on it. Because if you denature the venom, like you do with a mosquito bite, you actually cook the proteins in it so it becomes less inflammatory. And otherwise, I really like homeopathic apis, or you can use, my favorite is called Sanhongsan, where it's called herbal ice, where it doesn't impede the circulation at all, but cools it down radically. And I can spell that for you.
Yes.
San, S-A-N, separate word Huang, H-U-A-N-G, and last word is San again, S-A-N.
Thank you.
All right, other questions? All right, thank you.
No other questions. Okay, I just got set up with this microphone so people could ask. Hi, I'm Ted Suzelis.
And I'm Synthia Suzelis.
And we own Healthy Treasures Health Food Store here in Newton Falls. And this is our 25th anniversary that we're celebrating here. And we would like to just go into a little bit of how we got into this business and what brought us here and why we're doing this.
In 1980, our third son, Blake, was born with multiple birth defects. They were pretty severe, and they really didn't think that he was going to live beyond the age of 3. Through divine intervention, we were directed to some alternative practitioners in the area, and we're just amazed at the progress that he had. We talked to his medical doctors who had done surgeries and medications and thought they would really be excited about this, but they weren't. They said, keep him away from those quacks, but it just seemed that when you ask God for help, you better take it. And at that particular time, we started learning all about what would keep us healthier and happier for a holistic lifestyle. We already had a farm, and in the type of disabilities that Blake had came from chromosomal damage, and that was from the environment. So all around our farm there were people who were dying of cancers of all different kinds, kidney cancer, bowel cancer, brain cancer, blood cancer. These were all within the perimeter of our farm. So we started looking at the water and all of the different things that make a healthy people, and started raising foods more organically. And then I became very determined that this other people should have this kind of help also. And at that particular time, it was I had the opportunity to go to school to learn more about natural healing, and that's when I went to school and became a practitioner. In 1995, we had 5 children on the farm, and it was too far where I had to go before. So we moved to Newton Falls, which is only 4 miles from our farm, and found a community that we loved being a part of. Let's hear some of our customers now.
There's someone right there.
So for 25 years now, we have had the store here, and we really like helping individuals learn how to be healthy, stay healthy, and hi. Come, go right there. Go ahead. So as far as being part of the community here in Newton Falls for 25 years, we have organic produce, we have supplements, we have natural medicines that help keep us healthy, and also to help us learn how to take care of ourselves. Because in most of the communities now, we're told that we can't take care of ourselves, that we have to rely on medications and other things. But from our experience, first it comes from taking care of ourselves in our community with good healthy foods, good healthy water, and all of the things that help with the healthy people.
And I actually am a testament to her information that she's been using these last 35 years. I worked in a steel mill for 27 years. I was not an organic farmer my entire life, but rather we grew up on a dairy farm, my family, and I bought the farm in 1978, and I started conventional farming at that time as well. But health problems started me thinking in a different direction as well, and working with Cindy on my health, which has improved tremendously, I have to say, since we started all of this. And I got out of the steel mill, which closed. That wasn't my doing it at all, but I did switch to organic farming in about 2006, so that's about 14 years now. We've been raising organic grass-fed beef, and all of our vegetables and things that we raise on the farm are organic. And we do sell my ground beef here at the store, as well as some other meats that we get from Tierra Verde farms, which are also organic.
And local.
And if Cindy has anything else to say on that.
We kind of see a community of just not customers, but also of growers and other people in our community that make natural soaps, because soaps can have harsh ingredients too. So we have Katie's soaps here, just made in the area. We have
Boca Belly
that's
soaps
his
from
favorite
North
soap.
Canton.
Yeah.
That's my favorite, made from olive oil.
So we really
So
try to,
smooth and so nice on your skin.
So we really try to get as healthy as we can. We also have things for the pets in the family too, because they seem to be getting sick as well because of how they are mirroring the kinds of lives that we have. So we have natural homeopathics, herbs and things for our pets and our animals too. And oh, I probably should say that to make a long story short, that our son Blake is 40 years old this year, and he lives in Washington with his wife and 5 children. And
He's almost finished with his doctorate in psychology.
our oldest son, Dr. Ted, who you'll be hearing from, he is a naturopathic physician for like 19 years now. Our second oldest son, Dr. Ian Suzelis, is with a family practice with the University Hospital. Our son Blake is psychology. Our daughter Ashley is a holistic esthetician, uses all natural, organic as much as possible, skincare. And our youngest son, Garrett, is a musician. So
we did have the intention of bringing him into the flock here as well. He studied psychology and music with the idea to be a music therapist, but when he graduated with his bachelor's degree, they ended the master's program, so he never finished. So he decided to just use his music degree and make music.
I can't think of anything else that I probably need to tell you, but
We have plenty of speakers tomorrow, though,
Oh, yeah.
and we have other speakers coming just to do these spots in between. So if we need to talk to you anymore, we will.
I'm going to move this over just a hair. Okay, there we go. And I'm going to keep my mask on for this. But today I'm just going to be talking about some immune system basics, and I'm also going to be talking a little bit about something that's on everybody's mind right now, the COVID-19. And some of the different things that we can do that can help out our bodies, as well as some of the misconceptions that are out there. But let's go ahead and get started. We're just going to talk about the immune system in general. So today we're going to cover a couple different things, and I'm going to go through some of the slides. I'm not even going to address them because I'm going to be focusing on some other things. But the objectives, we're going to talk about the innate immune system and the acquired immune system, cells of the immune system and their function, organs of the immune system and their function, and some winter wellness tips, and again, the COVID. So of course, when you sneeze, you can see when we talk about all of this spread of germs, spread of virus, you can see in this they kind of show you how big of a spray can go out there, and that's why we got to cover when we sneeze. And also wearing the mask does help. And we can talk about that later if anybody has any questions. So what is immune? Latin immunis, it's to be free or exempt. People who survive ravages of epidemic diseases when faced with the same disease again. That's immunity. This is my son, Cohen. Cohen, you want to show yourself over there? This is him when he was about 10 years old, and can anybody guess, of course, what that is? Chickenpox is it. So that is a virus as well. And when we come into contact with that virus, our body develops immunity. We develop a long-term immunity so that we're not going to get chickenpox again. But so I just figured I'd throw that picture up there.
I'm
So
sure he
type-
liked it.
What's that?
And I'm sure he loved you for that.
Oh, he doesn't mind at all, do you? Types of immunity. We have the innate immune system. So this is the immune system that's our first line defense. These are things that are not specific, or they don't, like when we talked about the chickenpox and that long-term immunity, this does not do that long-term immunity. It's not very specific. And so you have a host defense mechanism that acts from the start of an infection, but does not adapt to a particular pathogen. Then we have adaptive immunity. This is where our body develops an immunity that can last. So a response of an antigen-specific B and T cell lymphocyte to an antigen. This produces immunological memory. So I just have the immune system kind of the tier. So if we start down at the bottom there, you can kind of see where we'll be starting, which is your first line defense. Your skin, your mucous membranes, the enzymes on your skin, in your mouth, the different bacteria that you have or microbes you have on your skin or in your sinuses and in your mouth, those all help as far as a first line defense. Then we have the innate immunity, again, that's the non-specific one. Those are going to be like your phagocytes, the natural killer cells, the granulocytes, the macrophages, and we'll get into what those are. Then, of course, we have that learned or specific immunity, which is your third line defense, and that is going to be the lymphocytes, the T cells, and the B cells. So our first line of defense, the skin. The skin, we have all kinds of enzymes on there. Again, these help to stop if any kind of invaders come onto it. They can digest it, they can disrupt them. The skin itself, this is another one of our defenses, first line defense. We know when we get a cut, it opens up, infection is able to get in. The pH of the skin is even something that helps us out. Different bacteria, different fungus, different viruses, they can actually be inhibited based on pH. The mucous membranes, they line the body passages, the mucus, the saliva, the lacrimal or the eye secretions. The cilia, which are the little hairs that you're going to have over in your respiratory tract that help to get out mucus, or over in your nose to actually help to disrupt things from going straight back. And then, of course, the beneficial flora.
I have a question, Dr. Ian.
Yeah.
Before you get going, I know the skin, you were just talking about it, that's the largest organ on the body, and you're talking that that's a first line of defense. But things go through the skin into our body. The viruses and things like that don't go into that and cause problems, or?
No, they don't. Because of those those different things we have, whether it be the enzymes or whether it be the different bacteria, or it's just, we don't have when we talk about viruses, they have a clear line of place where they're going to infect. Usually they're going to be specific to an area. For example, when we talk about, I'm trying to think of some good ones. Let's talk about warts. So a wart actually is a virus. It's the human papillomavirus. When it gets onto your skin, or it gets into your skin, it starts to replicate. And that's when we get those little warts that come up. That one, if you came into contact with it, if you swallowed it, if you breathed it in, it's not going to cause a wart through there, typically. I mean, there are different ones. There's a bunch of different types in that one. But the basic wart is not going to occur, or it's not going to infect like that. Mucus happens. Mucus can be good. It's one of those things, though. It helps to trap bacteria, different viruses, particles, gives our body a chance to go ahead and fight some of these things off as well. But it also can cause problems whenever you have too much of it. It's too thick, and then bacteria has a chance to grow. So then we come to our second line of defense, the phagocytes, which is great to eat. They engulf and destroy pathogens. They attack the invaders, and what they end up doing is they go along as they see them. They're not specific. They see something that's foreign, they're going to engulf it, and then they actually have some other jobs. As they break it down, they can actually alert the immune system to what's going on, so it's able to further take care of things. Different types. We have the macrophages. Those again are the big ones. They're the large ones. And again, they'll engulf the particles and bring them to the other parts of the immune system. And then as you see, they have a subtype called the APC, or the antigen presenting cells. So an antigen is a part of a particular bacteria or a virus. The antigen is what we're testing for, like when we do that nasal swab for the COVID. You're testing to see, are there some of those pieces of that virus there? And that's what we're checking for. But that'll present to your immune system so that your immune system can start developing in other ways. The macrophages. Now when you get a CBC, or your complete blood count, you end up looking at that. You have several different things. It says your white blood cells, which is just kind of the overall, where we're looking at the different types of these macrophages. And then it breaks it down. The macrophages, there you have the neutrophils. These are a type of white blood cell that attack mostly bacteria. That's what we think of. And they'll be elevated if we have a severe infection going on that's bacterial. The eosinophils, those are more for parasites. They'll be elevated if there's a strong, we'll say, allergic response, something to that effect. The mast cells also go for more allergens. Then we have the natural killer cells. I always loved these ones, especially when I was going through medical school, because they were just kind of cool. When I was learning about the immune system, I tried to make it so that I could remember it. And I almost made it was like the mafia. The natural killer cells, they were really cool because they would come over and they would actually shoot up the cells that were, we'll say, infected. They recognize them, and then they'd shoot these different proteins into them to kill the cells, if they actually induce the cell to die. So they monitor, they go around, they hook up to a cell, they check it, and if they find that there is an issue, they'll go ahead and they will destroy that cell. Of course, she has a fever. So what is a fever? When we look at a fever, we talk about this. I know a lot of people say, oh, I have a low-grade fever. When we talk about a fever, we're talking about a specific temperature or higher. The temperature of 100.4 or higher is what is considered a true fever. Pyrogens, produced by macrophages and leukocytes, those are the things that induce the fever. So the effects, I know a lot of times we go ahead and we try and suppress a fever. At least we hear people say, oh, you got to take some ibuprofen, you got to take some Tylenol to suppress the fever. Otherwise you may have a seizure or something. Well, truthfully, the fever is very good. You need to go ahead and help the fever. You need to support the fever. There are times whenever it gets higher that I think that it's all right, especially if you're very uncomfortable, to have to take Tylenol or to take ibuprofen or something that's going to help to bring it back down. Or there's a lot of natural things that I like to use as well. A lot of times I'll use like ferrum phos, which is a homeopathic, that can help to bring the fever down, or there's different reflexes that I'll work on too that can help them out, to help to normalize the body some. But whenever you do have a fever, what happens in the body? Well, it increases your metabolic rate. You start to increase the production of different things that will help to fight off the infection. Your immune system works so much faster too. So it helps to get things mobilized so that you can get to these infections or the invaders. It inhibits some viruses and bacteria. So when we get to certain temperatures, different viruses can't survive, different bacteria can't survive. But the biggest problem we have is that it's not comfortable. So what about the fever and causing this seizure? There have been lots of different research on that, and the high fever is usually not the indicator for a seizure to occur. And usually it's going to occur at the very beginning of a seizure, or very beginning of a high fever, if it's going to happen at all. But what ends up happening there is that usually people are very dehydrated. That's a big part of it. And they don't know exactly why it occurs, but it is very rare. The third line is the adaptive immunity. It's very specific defense. This is the one that directs against a particular foreign substance. This is where we say, that particular virus or that bacteria, we're developing immunity towards it. It works systematically, it responds to millions of antigens, and then our body remembers it. The lymphocytes are the ones that help us to remember. So you have the T lymphocytes, they're made in the bone marrow, migrate to the thymus to mature. They recognize the foreign antigens and they help to respond to them. They defend against abnormal cells and pathogens inside the cells. Now I'll just kind of skip through these a little bit, but they have different ones. They have the cytotoxic T cells, the T helper cells, the T suppressor cells, and the memory cells. Then you have the lymphocytes, and those are the ones that actually will help to produce the antibodies. So then we go through and we have the different organs of the immune system. We start up at the top, everybody's heard of their adenoids, and sometimes people have had those removed, especially when they're younger, if they're blocking things up over in the back of the throat. Your tonsils, the lymph nodes, which you have several of them all throughout the body. I mean, there's a huge network of lymphatics, and the lymphatics actually help your body as far as processing. Your lymph nodes are like, we'll say, a little warehouse where your cells will bring those different antigens to it. That way the body can respond and produce more cells and send them out to go ahead and fight. And the thymus, over in the chest here, usually as we age, it atrophies and we don't have as much activity. But still I've found that, and this is, I don't have any evidence for this, but I have found that taking thymus supplements can help out as far as some immunity as well. And actually even tapping over on the thymus can help to stimulate it some.
What kind of supplement would you take for this thymus?
A lot of times you actually take like a glandular, like bovine thymus or something to that effect. And then the lymph nodes, of course we kind of talked about those a little bit, act as filters or traps for the antigens. They become inflamed or enlarged, whenever they are being activated. So that's one of the things, people talk about, oh, I have swollen lymph nodes, but their body is reacting to what they're dealing with. And the lymph nodes and the whole system there. This is just talking about the mucosa a little bit. I mean, again, we have this whole tube. It starts in the nose, the mouth, goes all the way down through. The mucosa through there, it's going to come into contact with anything that we're dealing with. Our first line, we talk about the nose especially, and the sinuses. We need to have tissue there that's going to help to recognize foreign invaders so that it can help to be our first line defense as well. The spleen, of course, biggest lymph node we have. All right, so here's kind of a little graphic of what happens. The macrophages identify the germs. When a germ invades our bodies, macrophages gobble up the germ and display its surface, shape, or antigen for other immune cells to see. So you can see he kind of grabbed it and he's saying that he's holding that antigen, which is the arrow, out there so the body can recognize it. The helper T cell directs the defense. The helper T cell spots the foreign antigen on the macrophage, and then they begin to multiply. They alert other white blood cells and direct the body's defense. The B cells then make the antibodies. The B cells start to make chemicals called antibodies, and the antibodies lock onto the foreign antigens, making it easier for other immune cells to destroy them. So once they locked up that antibody, the body can go ahead and go along, recognizes them, and it cues it in to go ahead and grab those foreign invaders. The killer T cells destroy germs. Alerted by helper T cells, killer T cells multiply and destroy the invading germs. Working together, our white blood cells can usually destroy invading germs. And I just kind of put a couple different things about viruses. For this one, you can see an actual picture of the Ebola virus, but typically what you have, you'll have like you'll have the DNA or the RNA, and there's different types of viruses. And so what it'll end up doing, when it locks onto your cell, there'll be different receptors. And it'll lock on, and then it goes ahead and it injects its DNA or RNA into your cells, and then your body, it actually overtakes the machinery of your body to reproduce itself. It makes thousands, millions of copies, and then that cell kind of explodes and it spreads to other places.
Looks like something from the Matrix right there.
Oh yeah. So for conventional medicine for the wintertime, and there's many things that they have that we utilize. Now, what I wanted to talk a little bit about, instead of going through some of these, is more of the things that they're doing as far as for coronavirus right now.
While you're looking for that, I was wondering if there are a lot of lymph nodes in the abdomen area, because I've noticed as I get older, I get permanent swelling around this.
Good try.
Yeah, nice try. So, when we're talking about the coronavirus, I mean, this is something, the novel coronavirus has just come about as far as, this is what we're hearing about. It's novel because it has some different features. The coronavirus is something that we deal with on a regular basis. It actually causes colds, some different, we'll say, upper respiratory infections that are common to us. But this one has some different features that make it more infectious, easier to transmit. It has a lot of receptors on it, we'll say, that can attach to our cells. So it's easier to spread. Then it also has some different things that it does to our immune system, which we'll talk about those as well, and how some of the different things that we're using naturally or even through medications can help out as well. So what are some of the symptoms you hear about when you think about the COVID-19?
Coughing.
Coughing, yes.
Lost your taste, smell.
Loss of taste and smell.
Headache.
Yep, headache, fever.
Fatigue.
There's all kinds now.
Yep, fatigue, body aches. Those are going to be some of the main ones, though. When we talk about those are the symptoms we think of. Progressive cough that's getting worse. Now, we recognize those symptoms, but then there's also things like nausea, vomiting, diarrhea. Those even go along with it too sometimes. But sore throat, congestion. These are a lot of common things that we deal with. So those bigger symptoms, those are the ones we really pay attention to kind of cue us in to say, do we need to get tested?
Question on that.
Yeah.
When we say we experience milder symptoms like that, could it be actually from the coronavirus, just that our immune system is fighting off better than maybe some other people who have a lot more serious or severe symptoms?
It's difficult to say.
Yeah.
One of the things that we have seen as far as like people who are admitted to the hospital, the people that are, we'll say, more at risk, who are those people? Those are the people that have heart disease, people who have lung disease like COPD, people who have immunocompromised systems that like diabetes or like different types of rheumatic conditions, rheumatoid arthritis, and they may be on medication for that. Those are the people that are more at risk, and they tend to have stronger responses. When this virus comes in and attacks your cells, and this is from some of the research that I was originally reading early on, it does a couple different things. One of the things that it does is we have, in part of our immune system, we have those different cells. They signal each other by what we call cytokines. Cytokines are kind of, the different chemicals it sends out that tells our body, oh, this is what's going on. Oh, start a fever. Bring these different cells in, which our cells are what cause inflammation, doing their job. But this particular virus kind of causes, in some people, to have what we call a cytokine storm, where they have an overactive immune system at that point. But then it also inhibits, so it increases those different chemicals, but it inhibits the cells that we have that are coming to help out, and inhibits the cells around it from recognizing that there's an infection going on. So that's why it gets severe in some people. And we talk a lot about the airway, respiratory, let me see, more of the overactive, we'll say, lung problems and getting the shortness of breath, not being able to breathe, filling up with fluid in there. So some of the different things we do for those people that are in the hospital that are being treated. One of the medications you probably heard of is the antiviral remdesivir. And that one, what it does, so it mimics like the building blocks for RNA, which is how that virus will replicate, or part of it. And it gets in there, and since it looks like one of the building blocks, when it incorporates it into that particular virus, as far as the RNA, well, the virus can't complete making it, so it inhibits the reproduction of that virus. So that's why we use that one, and it has shown to be pretty good, actually, and has some good effects if you're hospitalized. It's not one that we're going to recommend for people who are just, having mild symptoms, or they have a strong enough immune system to get through this. Some of the other things that we talk about are like the convalescent plasma, and that is actually, so if somebody were to have the virus, their body's going to produce those different cells, we'll say, are the antibodies, so we can recognize it. And when they get through that, they've done this for hundreds, or actually over 100 years. You can take those different antibodies from one person, and you can give it to somebody else. Does it stop the virus? Not completely, but it gives their body a chance to get over it a little faster. They're not using this completely, though. They don't. It's been approved, we'll say, just for right now, but we are not using it, we'll say, across the board. One of the things you've probably heard of too, again, talking about those antibodies, the things that we are using, our own body uses to fight things off. You heard about whenever President Trump was, of course, in the hospital, they gave him the monoclonal antibodies. Those are antibodies too, it's the same type of process, but these ones are, we'll say, synthetically made, so that they can attach and give the body a chance to respond, but they kind of lock up or keep the virus kind of locked up some, so that our body can check it out or catch it and take care of them. One of the other things we've seen recently is the using dexamethasone. Dexamethasone is a steroid. So when we talked about this, we talked about that over-responsive immune system. When we take steroids, which our body produces steroids, but when we give these steroids, it helps to suppress our immune system some. Suppress that overactive cytokine production. This is not something we give to everybody. Again, these are for the sick people. Then the hydroxychloroquine, that was one of those ones that they talked about early on. When we look at that now, the hydroxychloroquine and the azithromycin, originally it started in China and in France, where they were looking at those because they have some different good effects. They were looking at the hydroxychloroquine because we give that to people who have rheumatic conditions, especially like lupus. It decreases inflammation. And they also saw whenever you went ahead and gave it, we'll say, or they did it in vitro, in test tubes, we'll say, it could actually act or deactivate the virus. Give me a second, I'm going to take off my mask. This is getting harder to breathe and talk.
Yeah.
Okay. Hopefully nobody minds if I try and keep the mask on. But so, what we found though, since we've gone ahead and we've done more studies, is that it actually can cause more problems. It can actually cause arrhythmias in the heart, and this is one of the reasons we don't use it. And we didn't find that there was actually benefit when we used it in studies. So it actually was more toxic, and it didn't do the job that we wanted it to do. So that's why we don't use that one now. They may use it in the hospital. There still may be a use for it, but it's not something we prescribe. And it definitely didn't show prevention either, which is one of the things they had looked at using it for.
So it doesn't really work that well for the COVID, but for lupus and other things, it does help.
Yeah, exactly. It can help to decrease that inflammation. Again, it did show that it could kill the virus in a test tube, but at the same time, it does have some side effects that it can produce.
What are the
And
side effects, do you know?
yeah, sometimes you can have some issues as far as your white blood cells, but the big one that we're really looking at is like some different arrhythmias, especially when given with the azithromycin, which is an antibiotic that sometimes we'll give for bronchitis, or we'll give for upper respiratory, well, not really an upper respiratory infection, but like bronchitis or strep throat. And the reason we gave that, or they started giving that, is because it also has shown to have some decrease in inflammation. And so that's why they're trying to, again, give it to see, can we decrease this overactive immune response? Any other questions about any of those? Any questions about COVID at all?
Here,
Yes.
let me get you on the mic so we can hear. That, everybody'd like to hear the question. I'll hold it.
I was just curious if we can get it again, if we've had it before. And then if we do get it again, do we not like build up some type of immunity to it so that maybe we wouldn't get it as bad the second time?
So that's not clear yet. There's some things that we don't have good answers to, and one of the things is that we've heard that where, yes, you may get it, but you may not have that long-term immunity. It may wane. I've read a couple case studies, and again, this is a small amount of people. We've seen lots of people who've had it, small amount of people, they've gotten it, it was very mild symptoms. And they got through it within 6 weeks, and these are people, the ones that I read about at least, they had other comorbidities, other conditions. And so then they ended up having family members who ended up getting the virus. They got the virus again. They had a much stronger immune response. It made them much more sick, and they were in the hospital. So there are some people that I think their immunity is not going to be there. And what they're finding, one of the things I can say is they're finding with some people, when you don't have a strong immune response, you may not have that long-lasting immunity either. Now there was one study that was done over in Iceland, and they tested their population, a lot of the population, I think it was over half of it, and they'd seen that there was a large amount of the people, or their population, that had the virus. And then they checked 4 months later for antibodies in those people, and the majority of people still had antibodies. So it's, again, one of those things we can't give a direct answer. There are some people that do have issues with that, I think, waning, and this is one of our concerns. But also, I think there are people that develop immunity and it stays. And also, like I was talking about up here, or like I was talking about, we have that memory in our body too. So that when we come into contact with this again, we may not have those floating around out there, but our body can recognize it and say, this is something that I need to produce. So when we're talking about some of the different things, right now everybody's probably heard for COVID, vitamin C, vitamin D, zinc, taking those and making sure that you're staying up on those. And yes, they do have some benefit. What I wanted to talk about though, I think, is the zinc. That's one of the things I think that it may be a little bit misunderstood. The zinc is a great one. It helps to actually normalize and decrease some of the inflammation. It's important for our mucous membranes, which is one of our first line defenses. When we talk about how much zinc you should have, now that's another issue, because I think that there's a recommendation that some people are saying, take 50 micrograms a day. That can actually be too much, and there have been studies that show that can be too much. What can end up happening, because it is a part of your immune system, but you can get too much and it can actually suppress your absorption of copper. So when you do that, the copper is also used in your immune system. And if you have a decrease in copper, then your immune system is not going to work as good, especially against viruses. What I would recommend is that you take zinc lozenges, and about 15, we'll say, micrograms a day, and then you actually can balance that out with, we'll say, copper as well. There are some formulas that have copper, and I'd say it's like, if I remember correctly, it's like 1 microgram to 15 micrograms is what you want to do as far as that balance. But doing the lozenges, the zinc lozenges, is what I would recommend versus taking zinc, and swallowing a pill all the time. And again, it can help to normalize the immune system. It can decrease that excess, we'll say, cytokine response. So the vitamin C, that one is one that's been interesting too, as far as what we've seen with the COVID-19. In China, they started doing some IV vitamin C right away, especially with the people that were sick, because it has shown some antiviral properties. And there was a study that was published not too long ago that showed that people who had sepsis, which is a severe infection in the body, we'll say, and some respiratory distress type of symptoms too, when they gave the IV vitamin C, thiamine, and also a steroid, hydrocortisone, I believe, or maybe the dexamethasone, it helped to, it didn't stop people from having to deal with an infection, but they were able to, they had a 28-day better survival rate, and that was the big thing. So they were able to, you had less deaths with those people. So the IV vitamin C has been something though that can really strengthen your body. Again, it works in many different ways as well, and it can support, number one, it'll support that first line defense. Your skin, you need it to help to make sure that your skin is, or it's used in the collagen of your skin and the production of that, and making sure that you have that barrier on the outside. Number two, it helps out as far as those macrophages I was talking about. They accumulate, the vitamin C accumulates in those cells, and then they are able to, they have different chemicals in there that are cytotoxic, we'll say are toxic to, they help to destroy, we'll say, the viruses or bacteria, and it helps out with that, and it also helps you to mobilize those cells more. And then for the B cells and the T cells, which is that, again, the longer lasting immunity, or that adaptive immune system, it helps you to differentiate those cells more. So it has many different things that it can do. What are the problems with taking vitamin C? If you take too much of it, of course, you can end up with diarrhea. We'll say cramping, that type of thing. So spreading out the dose is going to be good. And I've been recommending people take 500 to 1,000 milligrams a couple times a day. If you get diarrhea, you can back down. I've had other people even do higher doses. The other thing that can happen too is if you take too much of it, I think it's more the ascorbic acid, you can get kidney stones if you're prone to them. Oh, now I'm on to the vitamin D. This is another interesting one. So we talk about, again, if we're talking about that overactive immune response, the vitamin D is one of those that has also been shown to help to normalize that immune system some, as far as that function. When we look at people, again, who have rheumatic issues, have rheumatoid arthritis, lupus, those types of things, it's been shown the vitamin D has actually, or can help to normalize the immune system when you have it in a range, we'll say between 60 to 80, whenever we're checking the blood. So it can actually help out with decreasing, again, that inflammatory response, normalizing that inflammatory response. And the one thing we found with, we'll say, the COVID-19, people who were admitted to the hospital, the sicker people, they had, over 80% of them had low vitamin D. We can't make the correlation to say, well, if we take that, they would have done better if they had higher vitamin D, but we make that correlation to say, yes, we noticed that they did have low vitamin D, and these were the people that had the worser outcomes. But I do think that we know that it helps to normalize the immune system. It's important for the immune system, so I do suggest taking it. I usually suggest taking, we'll say, 1,000 to 2,000 IUs a day, and you want to take vitamin D3. It's 90% more absorbable than the vitamin D2, which is what they add to milk or things like that. And when you take it, you should take it with a meal because it's absorbed through, it's a fat-soluble vitamin. You need to stimulate absorption of fats so that you can absorb that. So that's why the vitamin D is a great one. I recommend that all winter long. It can help out with other viruses as well. Well, help out with your immunity overall. Talked about the zinc. I'm going to go ahead and skip to a couple other things. Oh, the N-acetylcysteine, this is a great one. So the N-acetylcysteine, that's actually a molecule that has many effects in the body. It's not just for the immune system. It's a precursor to what we call glutathione. Glutathione is something that our liver produces, and it helps us with dealing with toxins. It helps to normalize, again, inflammation. But the N-acetylcysteine is a great one. There's been lots of studies on it, and they're actually doing some studies now for healthcare workers to see if taking this on a regular basis will help to decrease their ability to get the coronavirus. Not that I'm going to kind of preface this first. We don't have the results of this, but it has been shown when you take NAC that it decreases the transmission of different other viruses, common cold type of viruses when we're taking that. It also helps to thin out the mucus, and like I said, when you have that thick mucus and it's just sitting there, that allows for bacteria to grow. So taking the N-acetylcysteine, or NAC, throughout the wintertime can help to thin the mucus, help to reduce your transmission of different illnesses. So that's one of the reasons to take it, and it can also help to decrease inflammation. So, and like you can even see here, it has a couple other actions as far as it can help out with chelating heavy metals, again enhances the immune system, counteracts some chemical poisoning, like when we have somebody that goes to the hospital and they've overdosed on acetaminophen, we give them N-acetylcysteine to help their liver to process it and get through it. Yes?
Could you show us what that
Yeah.
looks like?
Here's the N-acetylcysteine that they carry here from now. When you take it, I recommend actually taking, we'll say, 500 to 600 milligrams 2 times a day. You can do that all winter long. And actually, there was a great study several years ago that showed that people who had COPD or chronic obstructive pulmonary disease and were smokers, when they took this, it actually decreased their ability to, or their upper respiratory infections compared to other people who hadn't taken it that are in that same group by like 30 to 40%. So it's pretty significant. It can really help out as far as your immune system. Also enhances the immune system overall. The adherence as far as the cells as they're traveling, adhering to the sides of these, we'll say the blood vessels, their ability to actually produce chemicals to kill these different things, proliferation or production of these natural killer cell activity, neutrophil phagocytosis. And then again, I have the dosing up there. I'm going to skip over the echinacea just because I ended up going through a couple other things that I wanted to address that. Garlic. Garlic is one of those that I would recommend on a daily basis during the wintertime, more as prevention. And for the coronavirus, we can't say that taking it will stop you from getting it, but it can also help to decrease, again, inflammation. It can help out as far as strengthening the immune system, and it can work, they're suggesting it as a preventative, and that's either boiled or taken raw. You can do that or in pill form. I don't know, do we have any garlic up here? I don't know if we do. Well, I'll talk about this in a second.
What about
Do-
onions?
Onions, I can't say that I have any information as far as onions specifically for that, but onions have the allicin as well, which is the main active ingredient that helps to, it has its antimicrobial effect, or helps to kill the different viruses and bacteria. So.
One thing as far as garlic, I could mention, if you're married, make sure your spouse is taking it too.
I've had that problem before. She made me stop. And then oregano oil. Now this is a great one too that you can take on a regular basis. And so it has actually been shown, like over in 2003, it's 2002 or 2003, we were dealing with SARS at that time. It was over in China, we'll say, but that was that severe respiratory infection at that time, kind of related to what we're dealing with now. And after they had that and they were dealing with it, then they started doing some more research with the oregano oil. And it actually is shown to inhibit several different viruses, whether it's the adenovirus, the Coxsackie virus, some of the coronaviruses, but we don't have it specifically, seeing if it helps out as far as this particular one. Their studies haven't been done. But it does have a lot of good antimicrobial activity, so we do recommend it. It inactivates the virus, and then in 2012, do you remember whenever it was in 2009 actually, we dealt with H1N1, or the swine flu. Well, they ended up doing, again, research afterwards, and they found that in 2012, the oregano oil actually showed effective against killing that. It will decrease viral loads, which I've seen that before, interestingly, even enough in like hepatitis C. And this is, again, anecdotal. This is not something that I think has been researched, but we've seen people, as far as in practice, just their viral loads go down with hepatitis C even. So I do recommend the oregano oil. I think that that's a great one as well.
How much do you take it out?
Usually I suggest just taking whatever's recommended on the bottle. The capsules are a lot easier to take. Then you can also take the liquid. The liquid is just very strong when you take it. So the capsules or the gel caps are a nice and easy way to do that. This particular one I like, the Allibiotic, and this is what I give my family. I have them take, and I also take just on a daily basis throughout the wintertime to help out. It has the oregano oil in it. It has concentrated garlic. It has elderberry, which is also something we're going to talk about. So elderberry is very common around here. I mean, if you're driving out, we'll say in about July, you can see all these little white blossoms over in some of the fields around the side of the road, and then of course you have those type of little white blossoms, and then you end up getting those berries. I love elderberry, and it's one of the best tools we have, I think, in our repertoire for as far as an herb to help out as far as for wellness in the winter time. one of the issues that we ended up finding is that it was recommended, so this actually does help to stimulate that cytokine production. And so there were some people that made this jump whenever COVID came out and said, you shouldn't take elderberry when you get COVID because it could cause an excess cytokine response. Not that they have any evidence for that, but they made that leap to say that. What I would say is that actually came from a study done, I think it was in 2002 as well. And it was, they drew blood from 12 healthy people. They gave their macrophages some extract of elderberry, and it showed that it ended up producing or increasing like tenfold the production of some of these cytokines. To put it in perspective, so that was tenfold. Whenever we're looking at what's going on, because there's more than just those cells that produce the cytokines that we're having that were causing this cytokine storm in COVID. But with COVID, it's like 300-fold increase versus, we'll say, tenfold. So I don't think that they can make that comparison and say that. But also I see that it helps to normalize the immune system. Also, the elderberry has been shown to decrease the penetration of specifically flu viruses into the cells of our cells. It kind of blocks, we'll say, the area where the virus would attach to keep it from coming into our cells. So I can't say that that does that for COVID, but at the same time, I do think it's still a beneficial herb to use for winter health. And also, I don't agree with the statement, or I disagree with the statement, I should say, that it will cause the cytokine storm. So I still recommend that. Actually, I wonder if I can go back here. All right, so some of the different things it can do: antiviral for colds, influenza, and even herpes infections. It neutralizes the hemagglutinin spikes found on the surface of several viruses, again, so they can't penetrate your cells. They enhance cytokine production. The significant antioxidant potential, and during symptomatic illness, the dose is usually 1 teaspoon 3 times a day for kids, and then 4 teaspoons 3 to 4 times a day for adults. Those are the studies that have been done, and again, they can work very well. It's, again, very effective.
I think you have a little box behind you of that.
And here's some of the sambucus, but this is the elderberry. Question? Oh, okay. Then we'll skip through again a couple things. Or am I going the wrong way? Going the wrong way. Since I'm an osteopath, I utilize osteopathic manipulative therapy. And there are several different techniques that you can use that can really help out as far as the immune system, and they've been well documented in the osteopathic community through research as well. But these are some of the things that you can do that can help people so their bodies are able to fight things off better. And they actually have done some of this. They've been looking at it, and they've had different doctors going into the hospital to help treat people using osteopathic manipulative therapy, so they've even come up with some different protocols that you can do this manual medicine to help out. But these are just some of the techniques that I use with different people. Then there's reflexology. I like to use that as well. It's a system, of course, where different reflexes on the feet relate to different areas in the body, and working on these is supposedly able to help those different organ systems work better. It helps to relax the body. But I've actually found it pretty effective. I ended up learning this before I went to medical school, and I've utilized it a lot, and it does work well. So lifestyle tips. These are the things we need to do. So say we get the COVID, what are we going to do? Number one, we're going to isolate. We're going to stay home. You're going to want to get rest. That's very important. Decreasing your sugar intake is one of the biggest things. The sugar actually can help to it can cause your immune system to decrease. If we look at somebody who has diabetes, when their blood sugars are above 200, we've actually seen that it decreases your body's ability to fight things off. So there's one of the ways we can see sugar, we've measured it. It can actually cause your cells not to work as well. We talk about wound healing. If you have high sugar, you don't heal as well. We see these people, they have problems with healing because their cells aren't getting there to take care of these different infections as well. The sugar slows down your body. Eliminating dairy and wheat can help out sometimes. I find a lot of times that can be very inflammatory, and so doing that, I find the dairy especially can help out because some people are very sensitive to mucin. So when you have these upper respiratory infections, you have the mucus production, the mucin can make things more thick. So not doing the dairy during those times can really help out. Using a humidifier in the house or saltwater nasal rinses. Very important. So this is something that's really good. The saltwater nasal rinses, they've actually been shown to decrease the amount of virus that you have. They've been shown to help you to get over an infection 2 days sooner than other people who aren't using it, decreasing the spread to your family by like 30% when you do the saltwater nasal rinses, or even doing saltwater spray into your nose daily, on a daily basis, can help out. So I recommend doing the neti pot, or you doing some of the different saltwater nasal flushes, and you can do this several times a day, and it's not going to hurt you, but it can actually be very beneficial. Again, I can't say that it's going to stop COVID or stop the spread, but it's something you can do that's not going to be harmful, and it has been shown to help out with other viruses. And interestingly enough too, Johnson & Johnson, I think actually there was a couple different companies that did a study with hydrogen peroxide, and they did a little bit of hydrogen peroxide with the saltwater irrigation or the nasal irrigation, but also with salt or gargling. And they found that if you gargled for like 1 to 2 minutes, let me pull it, I don't want to give you the wrong information, let me pull it out because I printed it off too. Yeah.
Just a second, just a second.
I got a loud voice.
That's all right.
Okay, like I do the saltwater spray.
Yeah.
I also use oregano. Is that good too? The spray?
The oregano spray, like I said, as far as the oregano, I know definitely taking it orally. And,
I do that too.
But it has been shown as far as in, we'll say, basic research or in test tubes to inactivate different viruses. So it is a good thing to do. And it can help out as far as other
You can
microbes
use
as
both,
well.
like sometimes.
Yes.
Thank you.
No problem. So they just did a study, and again, this is not something, again, we can't say that this is going to stop COVID, but at the same time, it's something that you can do that can be beneficial. They just did a study where they checked out and they had you gargle, and it was with hydrogen peroxide-based gargles or doing the nasal rinses. And as for the, let me see, as a sinus rinse for this study, it inactivated 99.9% or more of the COVID, that particular type of COVID that they checked, if you did it for 2 minutes. At 1 minute, it was 99%. If you did it less than that, or 30 seconds, it was 90% to 99.9% that it would help to get rid of that virus. Let's see, and they used, again, the hydrogen peroxide rinses. So we can't say that these can stop it, but they can definitely be an added layer of protection for helping to decrease spread, because we're going to be killing that virus so we're not spreading things as much, and also helping to decrease the load that's in our body.
What about colloidal silver?
We don't have any evidence for how that interacts with viruses. I know that it does have some antibacterial benefit, and I do use the colloidal silver as well, but I can't say that how it interacts with the particular viruses.
As far as decreasing sugar and eliminating dairy and wheat, what kind of alternatives can you suggest? Eliminating sugar, there are substitutes.
Yes, so I mean, you have
dairy and wheat.
stevia or erythritol, xylitol, monk fruit. These are all lower glycemic as far as they're not as strong of sugars, or your body doesn't absorb them as much, and that can help out. So you still, if you have a sweet tooth, you're able to utilize those, but you're not getting that sugar, of course, the higher loads, that's going to kind of decrease the immune system.
With honey?
Raw honey is great again, but I recommend it in small amounts. I mean, that's what it comes down to. I read something, it was a couple years ago, that if we went back to the turn of the last century, people had on average, I think it was probably about, 5 pounds of sugar a year. That was the average, for everybody. Now we're looking at people have over 100 pounds of sugar per year on average. So I mean, this is one of the reasons that we really try and say, look, decrease the sugar. We're seeing obesity, we're seeing a rise in diabetes, we're seeing a rise in all kinds of other diseases that probably could be decreased if we decrease the sugar. And some of the different foods, I mean, I'm talking to the choir over here as far as trying to make sure you eat healthy, so. And of course, there's the sinus rinses. Other lifestyle tips: maintain good hygiene. Wash your hands often. Keep hands away from the face. Again, the masks. When we talk about the masks, they are beneficial. If you look at, it was right whenever we hit our fall, the end of our summer, the Southern Hemisphere just finished their winter. They had a historically low flu season this year. Why? Because we're wearing masks. We're social distancing, we're doing those types of things. That's my guess. But again, it showed that. So it does help to stop the spread some. We are dealing with a couple other things. I find, because I have to wear a mask all day long, I'm starting to notice I have more, we'll say, moistness in my nose, and I also end up, I'm guessing that there's probably, and I can't say that it is, but I'm guessing there's probably bacteria growing as well, because I have a different smell that I'm smelling. What I found myself, again, we go back to that hydrogen peroxide, the rinses, the nasal rinses, I actually will take a Q-tip and put some hydrogen peroxide on there and clean my nose with that just to go ahead and help out, or do the nasal rinses. But just a small amount in there, and it seems to really help out as far as decreasing that for me at least. Say no to smoking. Of course, that's a strain on the immune system and the whole body. Make sure you're getting your sleep. I can talk to my daughter about this one. But of course, proper sleep is important. Oh, this is something I almost forgot to tell you. So just recently, the Cleveland Clinic just put out that melatonin may be helpful in treating coronavirus. That was one of the things that they had found, and so I can't say that taking, again, melatonin is going to stop the virus, but it has been shown in lower doses that they're seeing, and this is kind of an association type of research. It wasn't something that they did an actual study yet, but they found that it may actually help out as well. But also helps out with sleep. It helps you to get on that regular circadian rhythm. And then make sure that eating smaller amounts or portion sizes is good as well. Your body takes energy to digest food, so making sure you eat smaller portion sizes, making sure you chew your food carefully, those are things that will help out also. Laugh a lot. Make sure you're laughing. It's so important. It helps out with the immune system. They've shown that before. Laughter is the best medicine. Try to minimize stress. I mean, we all have stress in our lives. So you look at those things that you can actually decrease and get rid of. We can't get rid of family members. Not yet.
Sorry.
Yeah. You'll have to keep on dealing with them. But looking at different ways in your life that you can reduce stress and make things more simple, it actually will help you out. The elevated cortisol levels, when they're on a larger basis, those are one of your stress hormones. It actually can suppress your immune system some. Exercise. Making sure you exercise. It helps out with circulation. It helps out to stimulate the immune system as well. Making sure you're breathing good fresh air also will help out. And any questions?
May I ask a question about herd immunity? Herd immunity.
Sure.
Yeah. Is there a natural herd immunity, or do we just have to wait for a vaccine?
All right, so that's a difficult question. That's all right. It's a difficult question because this is so new still. We don't know what our hope would be. And I mean, there is actually, Sweden has been going through, and they kind of said, we're going to put in some things in place, like helping out with the nursing homes. Those are people that are most at risk. And we're going to eliminate people going to them as much. But then they'll just let the virus kind of travel through their system. I've been trying to pay attention to what's going on over there, and I think that they actually had a huge spike and then it decreased and they've not done as bad, but I can't say that for sure. But they were trying to work with the herd immunity to go ahead and build it. That's the way we deal with things. I mean, typically the herd immunity is how we keep these larger things at bay. So the vaccine, do we know that it's going to help out with the herd immunity overall? That's what we're hoping for. We're hoping that as they give the vaccine, that some people will be immune, and then the people who don't respond to the vaccine, they're not going to be exposed as much. We still have the issue like you were asking about earlier. Well, do we keep our immunity? So if we give this vaccine, is it going to help to keep immunity, or is this something that we're going to have to continue to give over and over? It's difficult to answer that question. We just don't have all the information yet. So,
if the masks are effective,
yes,
and you go into places and people have the mask over their mouth, not over their nose,
yes,
that's an issue, correct?
yes, that is very correct. That is an issue.
The governor talked, and I wish he would have brought that up.
Yeah.
Because I see people everywhere think, well, I'll get the mask on over my mouth. I don't buy it.
So it is very true. And now, as far as masks go, just to clear up some things there too, like the surgical mask that I was wearing, studies show that this mask, as far as preventing, we'll say, the spread of things, is about 40%. That's right around where it is. If you have those N95s and you're going out, that can actually be 98% effective. But yes, if you don't cover the mouth and the nose completely, you'll be exposed to if there's something in the areas that's sitting in there. And also you are going to, if you have it, you're not going to prevent it from coming out, we'll say, and exposing other people. All right, so this is a little bit harder to read, but again, laughter is the best medicine. So wait a minute here, Mr. Crumpy. Maybe it isn't kidney stones after all. As you can read, if you can't read what he's writing as the guy is talking, it just says, just plain nuts. Whoa, that was a good one. Try it, Hobbs. Just poke his brain right here, where my finger is. All right, so, and Jim, Soki, are you out there?
He's right here.
All right, so I don't know if I've told you this pirate joke, so I'll just go ahead and say, because you asked for a pirate joke, and that'll be the last thing that I do, and then I'll get out of here. So there was a guy, he just comes onto the ship, new recruit, and typical, the pirate that he's working for, and so as they're going off and they're traveling one day, all of a sudden he comes over to the captain, he says, Captain, there's a ship off the starboard bow, what do you want me to do? He goes, "Arr, matey, go and get me red shirt." All right, I'll get you your red shirt. And so he gets it for him, and the captain puts it on. Then they end up fighting the other ship, and they win, and they did great. And so he goes, "Wow, Captain, that was awesome. Is that your lucky shirt?" He goes, "No, matey, I get me red shirt, and I put it on so that in case I get hit during battle and there's blood, the crew doesn't see it, and they keep fighting courageously." He goes, "Oh, I understand." So a few weeks go by, and then he comes running to the captain and says, Captain, there's 7 ships off the starboard bow. You want me to get your red shirt?" He goes, "No, matey, go get me brown pants." And that's it.
From the mustard seed market fame, and he's going to be talking about Hemp Luxe CBD product. Abe, it's all up to you.
Thank you so much. Hello, everybody. Thank you for being here. So for those that don't know mustard seed is my parents started a health food store, and it was in very similar origins as the Suzelises with this wonderful place. So congratulations on 25 years. It is a heroic accomplishment. Most people have no idea how challenging and difficult it is, especially to start a health food store way back when. Thankfully, we've had appreciating trends, and more people have cared about healthy lifestyles and healthy foods and products. But it is definitely now new because health food is now in the mainstream, and especially with the pandemic, everyone's caring about their health a lot more. That has not always been the case. We used to be the weirdos that people pointed and laughed at and made fun of because we ate twigs and berries and rabbit food in their minds. But again, it's really always has been about growing the best quality food, living a preventative lifestyle, because the saying in the health food world is an ounce of prevention is worth a pound of cure. We want to get healthy and stay healthy so that we don't have to use the medical system in the first place. So that's definitely something that I have to give a big round of applause to the whole Suzelis family for their amazing accomplishment to do so. And so I'm lucky that I grew up in a similar family. And so my parents, Margaret and Philip Nabors, started Mustard Seed in 1981. And they were in the Akron market, some trailblazers themselves. And my brother and I definitely give credit where credit's due. We got cool parents, and we're very, very lucky, and we want to sort of keep the tradition and the entire system going. So that's why both my brother and I joined the family business, because my parents are now retired, and so we really want to help keep everything going. So one of the things that we've done to put our mark on Mustard Seed's legacy is we created our own CBD company. And I always joke with people that our business model is like an octopus. We have markets, we have full service restaurants, we have catering departments. We'll do banquets on site, we do banquets, catering at homes off site. We're now supplement manufacturers, so now I'm the demo guy for this as well. So every single day we wear different hats. of what to do. Now the reason as to why we created our own CBD company is that when I was invited to be a CBD lecturer out in Denver, Colorado at the very first No-Go Hemp conference, I reviewed probably 100 different brands and products that were on display at that conference. I would only bring in probably 2 to 3 out of the entire batch. A lot of people in the CBD market, because it went from completely obscure and illegal to the largest supplement trend of all time. And that doesn't happen. It has never happened in my lifetime. We've seen the Dr. Oz boom and busts of whatever he focuses. People come in and buy it for 3 weeks and then they never buy it ever again. This is way different. And so a lot of people came from the marijuana industry. As the prices of medical and legal marijuana in Colorado started to plummet, it was basically the large scale corporations that came in and undercut the market and prices plummeted. So you had all these people who started the industry get, okay, there's no more opportunity for them there because they got outcompeted. And so basically CBD is what I call the next green rush after the medical and legal marijuana industry. Unfortunately, a lot of people from that marijuana industry who are now jumping over into hemp-derived CBD are not supplement manufacturers. They don't even know the laws on the books like DSHEA, the Dietary Supplement Health and Education Act, that my father helped pass. This is back when bipartisan legislation used to occur. And so they actually, because there was about to be a takeover from the pharmaceutical industry, they wanted to pass a law that if you wanted to get any supplement, they were trying to make it so that you had to get a prescription from a doctor. And we're like, whoa, 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 whoa. Vitamin C as a prescription? Okay, well, where do you draw the line? Vitamin C in supplement form? Well, how about the vitamin C that's inside of that orange or bell pepper? Do you have to get a prescription for that too? We're like, that does not pass the common sense sniff test. And I'm going to go down this rabbit hole just real quick. The natural food industry, they created a genius protest. They called it Blackout Day. And so for one day, they got all of the independent natural health food stores that would participate all over the country to put in basically paper jail bars over their supplements, and they would refuse to sell supplements for an entire day all over the country. And they said, listen, if this law passes, you will not be able to buy these supplements from us. You'll have to go get a prescription from a doctor. So they generated the most amount of phone calls to Congress since the Vietnam War, and then when people power actually worked. And they shut that legislation down, and then they got bipartisan legislation together to say, hey, listen, if you're going to sell supplements, it should be able to be over the counter because these are dietary supplements that help make people's health better. But you have to do it in a very responsible way. So you can't diagnose, can't prescribe. And so we're not doctors and we can't give medical advice. The problem is that the whole CBD industry, most all of them didn't even know that this law exists, or B, how to be compliant. So you had things like on the front label like CBD cures cancer and all sorts of illegal claims that you can't make. And I was like, oh my goodness, these people have no idea what they're doing. And there was only a couple that I saw. Hemp Fusion is actually one of them, is the early adopters, as being, they actually played it the most conservative of any company that's here. So a tip of the hat for what they did as well. Now, the reason why we wanted to do it is we didn't play it as conservative as Hemp Fusion because we wanted the highest potency at the lowest cost is what our go-to-market strategy was. And so that's why we created this whole thing. And since we've created it, it's turned into Mustard Seed's #1 selling brand of any product in our whole store because it's been so popular. So I've already talked about this, so I'm going to skip this, but it's the largest supplement trend of all time. So this is what hemp looks like. It looks an awful lot like marijuana because it is the same exact genus, Cannabis sativa L. I'll explain the differences in just a minute. But this chart over here that I stole from the internet, I love because it shows there are 50,000 different uses for hemp. It is a miracle plant that's not just good for CBD, but it's good for textiles, industrial materials, construction materials, all sorts of animal feeds, nutrition. It's really an amazing plant. I like this chart that I stole even better because it shows you all of the different categories. So for the hemp stalks, you can take the hemp herds to make all of those industrial materials. You can take the hemp fiber to make all of those other materials. But then the seeds can be made into hemp cake for food and beer. You can take the hemp oil and you can use it for personal care products, omega-3s, the hemp shell for flours, bakery products, the hemp meat for food, and everything. And I'm actually excited for hemp as animal feed is one of my favorite ones, because what do we feed animals in America? GMO corn and soy with a little bit of grass put into it, just because they're ruminants and you need a percentage of grass, otherwise it'll kill them. But it's really some of the least nutrient dense type of foods, and the production potential of hemp is so amazing. Guess what? It grows like a weed. And so it's really prolific and productive. And a very brief history of hemp is that the hemp is used far back as 10,000 years ago. So as in modern day controversy is relatively new, because the hemp and marijuana plant has actually been incredibly useful and used by different cultures all over the world. The oldest relic of human industry is a hemp fabric from 8,000 years ago, and it's still intact and strong. It's one of the strongest plant fibers on planet Earth. Guess what? I don't even have a cotton shirt that doesn't have a hole in it from when I was a kid, let alone a fabric from 8,000 years ago. The United States Constitution is written on hemp. George Washington grew hemp, as did Thomas Jefferson. And the anti-marijuana propaganda film Reefer Madness was released in 1936 in a very coordinated effort to help basically smear marijuana. And then, and that's how they spelled marijuana back in 1936, by the way. And then the hemp prohibition began in 1937 when Congress passed the Marijuana Tax Act by Harry Anslinger. So they didn't make it illegal, they just taxed it to suppress it. And it's because it basically threatened existing industries, like the timber industry, the paper mills, the newspaper industry, which Harry Anslinger owned. And so it basically was threatening the titans of industry. And of course, back in those times, they just used their might to smite out any competition. And so between 1937 and 1970, the US government actually recognized the difference between hemp and marijuana. They're cousins. So to give you the analogies to how you can think and sort of organize the differences between hemp and marijuana in your mind, dogs and wolves are canines. But there is a big difference between a Chihuahua and a gray wolf, very different in nature. And so while hemp and marijuana share the same genus, they are different varieties or species of that. And so basically in the evolutionary track, as it migrated from east to west, from Asia all the way across, we had marijuana go down to the southern route through Afghanistan, and it got hot because it had a lot more sun potential, so that it had the THC potential. Hemp went the northern route, and so that was a lot colder temperatures, so it went basically, that's where they branched off to do that. And so there is at least in all of Hemp Luxe products, there are traces amount of THC in all of those products. So if anybody gets drug tested or has some, I guess, reason why they don't want to ingest trace amounts of THC, our products are not for you. But I'll get into why that's better, I think, down the road to do so. But none of the products get you high. There are 0% psychoactive effects. It's really the CBD and all the other cannabinoids that are found within that plant that is the desire for us for that medical potential. And so then in 1970 became the Controlled Substances Act, created by Richard Nixon. And so that is when the US government stopped recognizing the distinct differences between marijuana and hemp. And so that's where it became a Schedule I drug, which means that there is zero medicinal benefit, and research into those were very hard because you had to get a government exception in order to study a Schedule I drug. Very controversial, which means all the research from it plummeted. But guess what? Israel does not have a Controlled Substances Act. They were allowed to study it, and basically the godfather of marijuana research was Dr. Raphael Mechoulam, was Israeli, and so that's how we got all the research on the endocannabinoid system and how the cannabinoids interact with the human body, and really how profound and important they are for human health. So it was 2014 when the Farm Bill passed. Section 7606 said as long as it's below 0.3% THC, it can be classified as hemp and not marijuana. That's basically the only way that the government can recognize the differences between the two. However, it was not legal then. There was a bunch of controversy in American democracy. We have all these institutions that have jockey for control of what to do, so it's complicated. But in 2018, the Farm Bill passed, and it's called the Industrial Hemp Farming Act. So that meant you could actually then grow and cultivate hemp. So now we have hemp cultivation in multiple states all over the country right now. And again, going back to the charts I stole that it has over 50,000 different uses, I am a huge fan for hemp cultivation that has nothing to do with CBD. And then also to state in Ohio, it was on July 17th of 2019 when Ohio Senate Bill 57 was signed into law. So in Ohio, we have a state law that mirrors the federal law. So I have zero concern about any legality issues regarding CBD products. Again, we've been selling hemp products since day one, and I'm sure you have too. Dr. Bronner soap, hulled hemp seeds, our hemp omega-3 oil, hemp seeds in protein bars, etc., etc. It's not been controversial the whole time. When CBD came out, because it was so closely linked to marijuana, a whole bunch of controversy. But again, I don't think that way. So there is a difference between how you grow hemp. You can grow hemp for 3 ways. Again, going back to that chart, you can grow them for the stalk. So that's what they're doing right here. You can then also grow them for the seed. That has different farming practices to get the most amount of seeds out of that. Growing medicinal hemp is more like growing high potency marijuana. It's over here on the right. So industrial hemp, it is all grown together. It's a mixture of male and female. You just scatter the seeds out and they grow like 12 feet tall, and it's packed kind of as tightly as wheat. Now, medicinal hemp, those are all queens, so those are all females. They're separated in rows about 6 feet apart from each other, socially distancing before it was cool. And again, what they want to do is they want to rob any pollen from fertilizing those flowers. So that way those flowers continue to grow bigger, bigger, and bigger. And that's where you get the cannabinoid density, is in those flowers. And that's what marijuana buds are those enlarged flowers just waiting to get fertilized that they never do because they don't want the males around to do that. So that generates the maximum cannabinoid potential inside of it. Now, there are 2 types of systemic cannabinoids. One are called endocannabinoids. Endo means comes from within, and then there are phytocannabinoids. That means comes from a plant. So anybody who thinks that cannabinoids are controversial, you need to look in the mirror, because anytime you meditate, cannabinoids are produced. It's called anandamide, the bliss molecule. And if you ever meditate or do yoga or Tai Chi, anything like that, those endocannabinoids are produced. So if you ever, when you get done with meditation or massage, you feel like you just got out of a warm bath, that calming feeling is literally cannabinoids that our body's producing. It's found in mother's breast milk, so when a child nurses, it's not just sustenance and nutrition that the child is gaining. It's actually cannabinoids, which helps calm the baby down as well. And so 2-AG and anandamide are the most common. And then also same thing with the runner's high. So if there's any long distance runners in there, the runner's high is that feeling. And so the phytocannabinoids, of course, the most famous cannabinoid found from plants is THC. That's the one known psychoactive cannabinoid that gets people high. And for any of the CBD supplements, we don't care about that. It does have medicinal potential, but most people just use it recreationally for that. And of course, the second most famous cannabinoid found from plants is CBD. So most people come in here who are interested say, hey, where's your CBD supplements at, right? Well, that's merely one chemical compound found in the hemp plant. There are 111 additional cannabinoids found in the hemp plant. And we don't just want one slice of what nature has to offer for us, we want the whole spectrum of doing so. That's why we don't mind that there are traces amount of THC within that, because we want to take a raw extract from the plant and not really tinker with it, because we want to get as close to nature as possible. Now, what's really interesting, and again, Dr. Raphael Mechoulam discovered what's called the endocannabinoid system in 1991. So how long has medicine known about our cardiovascular system, our immune system, our lymphatic system, our musculoskeletal system? Now, we have all of this mapped out, but yet there is an entire system found in the body that's really not even taught in medical schools to this day, but yet it was discovered in 1991. And that is the endocannabinoid system. And what the heck does that do? Think of the endocannabinoid system as the orchestra conductor to help modulate other different systems in our body. So if something is overactive, it helps slow it down. If something is underactive, it helps speed it up. And so it's really a balancer of what you want. Really, my perspective of health is equilibrium. We want to be in balance with one another. So we have the CB1 receptors and CB2 receptors. The CB1 receptor are the light blue ones. Now, THC fits into the CB1 receptor, so it's no surprise that they're most concentrated in the brain and down the spinal column in your nervous system. But it is found throughout the whole body. CBN fits into the CB2 receptor. And you see how a lot of those dark blue spots are around the intestinal tract? Well, 80% of our immune system is in our digestion. That's part of why it's so important to keep a healthy digestion going. It's basically the first system to look at if you're looking to improve your health, to do so. Now, what's interesting is CBD can fit into both. It's ambivalent. And what's actually used, if people, like there's a whole issue going on like in marijuana legal states like Colorado, you have marijuana tourism. Anytime you have marijuana tourism, people act a fool and don't know how to use the tool properly. So it's people get in trouble not when they smoke too much, but when they eat edibles. It actually gets converted in your liver to 11-hydroxybutyrate, which is 5 times more psychoactive than THC alone. And when you can eat, and it takes about an hour to kick in. So you have these marijuana tourists going to a place like Colorado, buying legal marijuana edibles in a dispensary, to eating some, getting all excited, oh, I don't feel it yet. Then they eat more, and then they eat more, and then it all hits them like a freight train all at one time. And that's when they get in trouble, and they feel like they're spiraling or dying, or it's real bad. So they call the hospital and they go into ambulance. They get sugar water and CBD is how they get treated, because CBD actually can kick THC out of the CB1 receptor, making the psychoactive effects go down. So anybody that's concerned about feeling funny after taking CBD shouldn't really have any concern, because if there was any THC in your system, it actually would kick it out over there. So THC is called the agonist and CBD is called the antagonist, and it's kind of a yin-yang relationship in doing so. And again, our endocannabinoid system regulates all these other systems, and it fits like lock and key. So it is an incredibly natural process. So it's really important for me to let you know that it is possible to have interactions with pharmaceuticals. So if you're taking any pharmaceuticals, either do your own research or talk with your doctor before starting it. I have no interest in policing that world. Pharmaceuticals are not my passion. Natural food is, so this is what I focus on, but I have to be responsible at least to let you know, just in case that dynamic exists. Okay, so this is what I call the meat of the presentation. What the heck is CBD good for? Everything, right? Because how many people have heard of CBD from a family member or friend? Most people. It's gone viral in the traditional sense of the word. Oh, I use it for anxiety. Oh, I use it for my pain. I use it for this. If you have any condition X, hey, try CBD for that. But many people don't actually know how it works, what it does, or what it's good for, or even how to time it, et cetera, et cetera. So that's why I'm here. So again, this is what's called DSHEA compliant language. I am not allowed to give medical advice. I'm not allowed to call CBD a potent anti-inflammatory because I'm not a doctor, and that's using medical language. So what I have to do is I have to transform it into compliant language. So if it sounds vague, it is designed like this on purpose to keep legally safe. And so it supports a healthy inflammation response. Now, one thing I always like to highlight is that what science and research has learned is that cellular inflammation is one of the key drivers to most chronic conditions. So while I'm not making any claims of how CBD can relate to any chronic conditions, I just think it's a really good idea using my common sense sniff test to say, hey, if we can lower our overall cellular inflammation in the body, that's probably a good idea. CBD isn't the only one of them. I like fish oil a whole lot for that. I also, and many other omega-3 fatty acids, I also like turmeric that's bioavailable, which they have many great products here. I like to use all of those tools in the toolbox to help mitigate against cellular inflammation. In America, we basically are in a pro-inflammatory culture. We eat too much sugar, we eat too many grains, we eat way too many omega-6 and 9 fatty acids versus omega-3s. And the standard American diet is basically a road to runaway cellular inflammation, and our medical results reflect that. And so just as number one of if you can help support a healthy inflammation response, I think that is something that is viable for almost everybody to help with most things. So just at point one, it casts a very wide net to do so. Now the other part, besides just how cellular inflammation contributes to chronic diseases, a lot of people need it for acute inflammation. Chronic pain is rampant in America. Most people have at least some sort of part of that. And that is the number one reason why people tell us why they use our products, is for chronic pain. Now the number two, and again, helps with pain support, and helps promote a sense of calmness and well-being. This is the number two reason why people like to use it, is basically for social anxiety. And it can really help, for me personally, it helps take the edge off. Again, I don't feel the effect in a way that I'm getting distorted. It just really helps nourish the endocannabinoid system and promotes a sense of calmness. So for me, I'm a pretty happy-go-lucky person, and I like to have fun and do that, but I also run a really complex business with 250 employees. It's intense. And so I like this because it helps me be less reactive in incredibly fast-acting, acute, stressful situations. I find that for me, I am a lot more stable and I'm a lot more grounded. That is very important because as an owner of a business that is Mustard Seed, anything that I say or do or body language has amplified impact on my employees and also on customers. So I have to be really, really intentional and conscious about how I'm coming across to people. I'm a lot better at doing that when I am a lot more grounded and calm to do that. Helps with focus and mental clarity. Who doesn't need more of that? Supports anxiety reduction. It helps with restful sleep cycles. And sleep is our human superpower. If you are not getting 8 hours of sleep in complete darkness, which is why I wear a sleep mask when I sleep on a consistent basis, you are literally not charging your human battery every day. So imagine going around with your cell phone at 50%. That's not nearly as cool as having a full charge to get you through your whole day. A lot of people crash in the afternoon at lunch or have to jolt themselves with caffeine to come back up, which can, if you do that on a repetitive cycle, can tax your adrenal glands, et cetera, et cetera. It's not really a sustainable path. So if you're not sleeping with your full potential, then you're missing out on a whole lot. And unfortunately, those 8 hours do matter. The last hour of sleep from hour 7 to 8 is almost a full hour of REM sleep, and that's when you actually recover. You only grow when you sleep, you only heal when you sleep, you only detoxify when you sleep. And so for those that just shirk the importance of sleep, I dare you to try it for 1 week. If you go to bed at the same time and get full sleep in complete darkness, again, a sleep mask is what I use to do that. Most people are amazed, like, oh my goodness, I have so much energy. It's like, yeah, well, it's one of the fundamental things of how we recover. So CBD is really great for that. Helps with nausea reduction, supports a healthy cardiovascular function, and helps with the strength and recovery time of broken bones. I did not see that one coming, but it's pretty cool. Okay, I've already talked about this a little bit, and I'm going to go through it kind of quickly. So while I can't make claims of what it's going to do for you, there is a marketing research group that has analyzed a year's worth of social media posts, basically seeing what are people's testimonial, what do you use it for. So of that group, that research, 52% were women and 48% were men, makes up 1.3 million customers. So this is a large sample size. And using statistics and extrapolation, it's definitely reflective of the entire country. 41% were millennials, they were already advocates, and 91% of those posts were positive. So if you know a millennial that is pro-CBD, it's most of them. Gen X is 18%, they're emerging super fans, but cost is a concern. And baby boomers are also 41%. And this is basically the opposite of how you talk about CBD to a boomer versus a millennial. They do not want to get sold on the hype. They're like, just give me the facts. Is it going to get me high? Is this legal? Like, don't try to hype this up. Just shoot me straight right here. And so I definitely modulate my style depending on target audience, as you should always. So again, of those 1.3 million people talking about it, 280,000 posts were about pain management. And specific conditions discussed most frequently include chronic pain from cancer, inflammation, joint pain, fibromyalgia, and arthritis. When talked about pain management, 91% of those posts about CBD oil's efficacy were positive, including my pharmacist told me it's much safer than Tylenol. Do you know how much Tylenol you have to take to cause liver damage? 1. And yet people take it all the time as if it's over the counter and causes no harm. That's not true. It also wrecks your anti-inflammatory inflammation pathway. So if you're taking Tylenol or aspirin and yet you're taking fish oil, you're not getting the benefit of doing so. And so I'm not a fan of that. I'm a big fan of the natural stuff to do so. The second post, or second biggest reason why people use it is for anxiety and depression. Those were 250,000 posts. Conversations focused on CBD oil to relieve stress, anxiety, insomnia, and general depression. Many conversations about using CBD oil to regulate moods without side effects or feeling high, or drug-related addictive properties. When talking about mental health benefits, 90% of the posts about CBD oil's efficacy were positive. So if you're dealing with pain management and anxiety with such glowing reviews, no wonder why it's the most popular supplement of all time. Again, it casts such a wide net that has so much potential benefit for so many people. To me, it's one of the universal supplements that fits for most people. Then again, health and beauty, so skin conditions like acne, eczema, rashes, psoriasis, slowing down aging, reducing inflammation related to skin conditions. Those white little bumps under my skin and my face are going away, said somebody. And all the posts were 92% positive. And pet care had 100,000 posts, and that all those user experiences were 95% positive. And it's a big problem because the kibble that most people feed their pets has been processed at such high temperatures. It has 192 times the amount of carcinogens in them because of that proteins have been oxidized. So like when you grill steak, that char is that chemical reaction, it turns to a carcinogen. Well, basically all kibble is high density of that chemical transformation. And that's why a lot of pets, their age expectancy is actually going down over time because the quality of the feed has gone down over time. So of course, that's why we want to keep our furry friends nice and happy and healthy too, and that's why CBD for pets has been really popular for us. I'm going to skip that one. Does anybody know Charlotte Figge? I don't have time for it. Charlotte Figge, she had Dravet syndrome, and which is a rare form of epilepsy. She would have basically a grand mal tonic-clonic seizure about 1 every 15 minutes, which is almost perpetual seizing. Her parents often thought she wasn't going to make it through the night. They went to the hospital multiple times. They've tried every single seizure drug, pharmaceutical that existed. The doctor finally said, this is the end of our rope. We don't have any more options. They happened to be living in Colorado right when the Stanley brothers, who created the supplement brand Charlotte's Web, were growing a form of marijuana, but they were growing it not to get maximum THC expression out of it. They were growing it for maximum CBD expression out of the plant. And there's an inverse relationship. So it had about 18% CBD and only 0.5% THC in that marijuana plant. Through doctor-approved medical marijuana channels, Charlotte was able to get medical marijuana for high CBD marijuana, and she went from about 200 grand mal seizures a week down to 0 to 1, which is over a 99% reduction. And it basically just immediately worked for her. Unfortunately, it was just this year that Charlotte passed away at age 13, but it improved, CBD improved her quality of life night and day to do that. So again, a lot of people talk about CBD. That's over on the right-hand side. CBD is just one of the chemical compounds found in the hemp or marijuana plant, and I think full-spectrum hemp extract is way cooler because instead of a little sliver of the hemp plant, we want the entire potential that nature has to offer. And so each Hemp Luxe product is 64% CBD. So we call it CBD dominant because CBD is one of the most important components of how it works. But it contains over 100 different cannabinoids, not just the single CBD. So that's why it's full spectrum. It's much more comprehensive, and it harnesses nature's synergy, what's called the entourage effect. Again, Dr. Raphael Mechoulam in Israel discovered the entourage effect, and that means that all the other cannabinoid compounds helps the CBD work even better. So that's why 64% CBD is not, I guess, skimping on you. All that other goodies in there make it an even higher quality product in our opinion. It has less than 0.3% THC, and it is not psychoactive, and no, it won't get you high. It also contains terpenes, essential fatty acids, and bioflavonoids. Again, we want everything that the hemp plant has to offer. So, while CBD is a main superstar, there is CBG, which is actually the stem cell of cannabinoids. Both THC and CBD were CBG before it became into that. There is not even research on this because we don't have enough compound to study at the moment. But at the end of the day, CBG might be the end-all be-all superstar because the theory is that it has the potential to turn into whatever cannabinoid that the body actually needs to do so. There's CBC and then all your Baron strains. And so again, the research on this is relatively new. I don't have conclusive stuff, but it's exciting to me. And that's why using my common sense sniff test, yeah, give me all of them. And with the actual research that the entourage effects makes it all work better, I'm in. So this is the different bullet points that are on every single Hemp Luxe product. Now, watching how people interact with supplements for my whole life, I definitely understand that if you have the best packaging and the best education, you're going to sell better than other people. So many supplements are opaque because of DSHEA, the Dietary Supplement Health and Education Act. No one's allowed to make claims, so you're going to get smacked down by the FDA, you'll get pulled off the shelf, all sorts of stuff. But again, that's why using our experience of how you can talk about this stuff legally comes into play. And the goal is, it's physically impossible for me to talk to every single person that comes in our supplement aisle. And so I wanted my main talking points to be reflected as simply as possible on every product. So if you were picking this product up and you had zero human interaction, you could learn most of the really important things about the product. So first are the genetics. Again, there's a big difference between high potency medicinal hemp and just industrial hemp. That's not the medically potent CBD stuff. So you really have to get your genetics to get maximum CBD expression out of it, and then you have to grow it in that way. And so our hemp has been carefully bred to specialized genetics to increase the potency of the phytocannabinoids in the product. Basically, it's Colorado grown top shelf. We went with the best that we could find. Again, it's certified organic. That's really important to us. Not just that you're going to get a cleaner product for you, it is also farming organically is way better for the planet. It avoids all of the toxic fungicides, herbicides, pesticides, synthetic fertilizers, which are water soluble. Every time it rains, farmers need to reapply it. That gets down into the watershed, goes up the Mississippi River, contributes to the dead zone in the Gulf of Mexico from the algae blooms and busts that happen over there. So it really does matter to grow without these toxic chemicals. We use a CO2 supercritical extraction. CO2 is, most people know, as the gas contributing to climate change. Well, just like water can be steam in a gas state, or liquid in that state, or a solid in its frozen state, when you cool CO2 down, it goes from a gas to a liquid. You can use that liquid CO2 as a solvent to extract those cannabinoids from the hemp plant. You then heat that extract back up, and all of that CO2 turns back into a gas, leaving you with a solvent-free extraction. And so that's, to us, really important, because you can use nasty chemicals like hexane to extract from plant matter. That hexane never fully goes away, and it basically taints the extract that you have. So these are the really minutiae details that I delved into. And if I was going to create our own product, I literally have to leave no stone unturned because I care about every single darn variable, and I feel lucky that I've been educated from the best of the best in the industry to figure out what to look for. If you don't know what to look for, you're never going to be able to focus on doing the best job you can. So again, I already mentioned it, but ours is a full spectrum extract. If you see CBD isolate, that just means it's CBD only. If you see broad spectrum, that's more of a full spectrum, but it doesn't have THC. So Garden of Life is one of those that has zero detectable THC for anybody who gets drug tested or wants to avoid THC. Again, THC being the agonist, it actually lights up our endocannabinoid system, which then the CBD can modulate. So I like the trace amounts of THC in the Hemp Luxe products, but again, I like to be transparent, because if you are getting drug tested regularly, all these words I'm telling you right now don't matter. Well, you can still get access to CBD with broad spectrum. I think that's cooler than just CBD isolate. And it's guaranteed to be less than 0.3% THC, because if it was above 0.3, it would be classified as marijuana, and this guy would not do well in jail. So, and then also third-party testing. That's really, really important, is that it's trust but verify. And so we want to use the highest quality ingredients putting in there, but we also send it off to a third-party lab once the product's already finished to say, hey, go verify it, give us the test, and so we will show you those same tests for the exact batch number of the product that you're holding. We'll let you know, we'll email you over those third-party tests, so then, again, you can just get the proof, not just listen to me. So this is our 3 different flavors and 3 different potencies of those tinctures. That's the most common form, is in the tincture form. People put it under their tongue for a little bit and then swallow the oil. And every person is different, and there seems to be a dramatic spectrum in how much CBD it takes to solve certain problems. Some people who are very light and delicate and are only using CBD as a tool in the toolbox for things like slight social anxiety, small doses might be okay for them. Other people, like the big trucker who needs a hip replacement that is the size of an ox, he probably needs a lot more to do something with a lot bigger of a problem. And so everybody is unique. It's called bio-individuality is the term. So you have to really know who you are. Are you sensitive to stuff, or are you not? My mom is a delicate flower. She only needs a little bit. My dad and I, lay it on us, it's fine to do that. So that's why we created a lot of different stuff. So the original strength is 14 milligrams of full spectrum hemp extract per serving. And there's 30 servings in those 1 ounce containers. Now, as I mentioned previously, all of our products are 64% CBD. So that means 14 milligrams of full spectrum yields 9 milligrams of CBD. A lot of customers like to do apples to apples comparison, so we measure both the full spectrum extract and then how much CBD is a part of that. Now our extra strength is a 2x concentrate. So instead of 14, it's 28 full spectrum. Instead of 9 milligrams of CBD, it's 18 milligrams of CBD. Now, the benefit to your wallet is that you save a little bit of money by jumping up to that next concentrate to do so. And my favorite is our max strength product, which is a 6X concentrate. It's probably going to be the most potent CBD product you'll find in almost any set that exists. But there's not just a little price break once you get up from extra strength to max strength. There is a dramatic price drop. And so we look at the measurement is called what is your cost per milligram? How much money am I paying for how much CBD or full spectrum am I getting? This max strength product is the #1 cost efficient product of any product that we have studied. And we have keep adding all the different products into an Excel spreadsheet to analyze all this information. I was shocked that we were actually able to create, so even though the max strength is expensive, it's over $100 a bottle, but if you translate cost per milligram of what you're getting, it's #1 in most efficient. Now my trick is even if you're at the lighter end of the spectrum, you don't need to take a whole serving. You can take a half a serving or 25% or even a drop at a time. And so if you're going to be using it ongoing, the stuff is not cheap. It's where the market is. Its prices are coming down, and that's good, but it's not there yet. And so if you're going to be using it ongoing, the most efficient cost per benefit is the max strength. And we have the 3 different flavors. We have the all natural, which is just tastes like the hemp oil. So if you ever tasted hemp oil from the refrigerator, that's what it tastes like. It tastes grassy, earthy, tastes like plant matter. But for the purists who just want the hemp plant and nothing else, are all natural flavor. The peppermint is very cool, minty, and refreshing, kind of like an Altoid-like flavor, or peppermint oil. And then the mandarin orange is our most popular, and it's my favorite. It has a hint of vanilla, which I find luxurious. So if you don't want to measure with the measuring of an oil tincture, and you just want to pop a pill and take it with you, the liquid soft gels are probably the product for you. I also like that because you can take it with you, like in your pocket or in a purse with you. And if you're going to take it when you're away from your house, because you don't want to carry a whole bottle around all the time really, and so a capsule is really great just to take on the go. The reason why I like that is because most people make a mistake and do not take CBD with food. If you're going to take CBD, make sure you do it with a meal. All cannabinoids are fat soluble, so it means that you need dietary fat for that CBD to mix in with, so you can actually go through a digestion cycle, then your liver can then metabolize it to get into your bloodstream. If you take CBD on an empty stomach, you're only getting about 7 to 10% of that. And so a lot of people think that it doesn't work, is either A, not taking enough, or B, not timing it with food, or worse off, both. So you really have to dial it in to figure it out. But the good news is that once you dial it in, your question mark has been answered. And so it's a one and done process. So same thing, we have a 30 count bottle, a 60 count bottle, and a 120 count bottle. You just save money per pill as you buy in larger, because we want to make sure that, again, if you can try it at a low dollar test, but if you're going to do it ongoing, the largest product is the most cost efficient cost per milligram. And so all of the pills are 25 milligrams, so every pill is exactly the same. Then we have the topicals. The first ones are creams over here, and the creams up top are kind of like face lotion. It's very light, it rubs in very easy. And the balms below, this is more like a salve. It's in like beeswax and olive oil, and so a little goes a long way. Like the size of a Q-tip head will cover my whole arm, and it's wet and greasy. That's good because it lasts a long, long time. It's bad if you don't rub it in all the way. It can transfer to other stuff. So some people like the light and easy application of the cream, but it's less potent. I like the balm way better. It also has organic arnica in it, so it has a second superstar ingredient for pain and inflammation support. And the benefit of rubbing and rubbing and rubbing until it's dry is it actually sinks it deeper into the dermis layers, making it more effective. Now then there's always the question, where should I start? Should I ingest it or should I use it topically? I recommend ingesting it as step 1, because if you can get whole body relief from the inside out, that's better than slathering your whole body in it every day. And you're also nourishing the endocannabinoid system, which has internal cellular health benefits. So that's where I start as number 1. The benefits of the topical is that it absorbs incredibly efficiently through your skin. You also don't need to time it with food, and the cannabinoids stay in the local area, so those local cannabinoid receptors are saturated. When you ingest it, it gets dispersed all over the whole body, so it starts to dilute. And so it's not one is better than the other, it's different tools for different purposes. So I like to ingest it as step one, but if there's any spot needs afterwards, the topicals are really, really quick acting for me. In fact, I call it the Hemp Luxe Spot Pain Challenge. I dare you to try it. And again, as I mentioned, pets can take it too. The size of the animal matters a lot. Also for dogs, don't ever give them THC. They have very little CB1 receptors, so if they get THC in them, it has an amplified impact on them and can make them feel really bad. So I would not suggest medical marijuana products for dogs, just as a warning. We've never had any problems with our products with dogs with that issue at all reported, but I like to very much tell people the third rails to watch out for. It's not good for humans because it's in fish oil, but that's really good for dogs and cats. They love it. So this is Nala. I just left her, it was so sad. And so she was my girlfriend's family's dog. She was found on the side of the road with no fur in the middle of wintertime. The family picked her up, took her to the vet, nursed her back to health. The vet didn't even know what species of dog it was until the hair grew back. So as a result, she has extreme separation anxiety. Anytime I leave, she's like, no, don't leave, and she gets really shaky and she'll start crying. And it's because of that experience that she had. Well, thank goodness that Hemp Luxe stopped this cycle of every single time I would leave that she would freak out. My girlfriend didn't tell me the first time I dog sat, by the way. It took me a half hour to leave the house, and it was an emotionally just treacherous experience. Now, we just feed her some Hemp Luxe, and she literally gets calm and lays down in her bed and takes a nap. And so it works great. There's been 0 deaths from any CBD or THC ever. So it's incredibly safe as a compound. So, really the ultimate price is not a part of this equation. But too much CBD, there can cause drowsiness, but there's no really other side effects. And what pharmaceutical can say that? As I mentioned before, there's THC in there, so if you're getting drug tested, steer clear. Again, how much and how often? Well, I'm not a doctor. I can't tell you how much to take because that would be prescribing medical advice to you. So everybody has, again, as I mentioned, you're either on the spectrum of either sensitive or not. You have to figure out what your constitution is. And then after that, how much to take per day. Well, guess what? Start with 1 serving of the least potent one on day 1. If it does what you want, again, time it with food. If it does what you want, great. You're a one and done test. If you wanted to do more, on day 2, try 2 servings. If 2 servings of the original strength is where you're at, then you'll save money by upgrading to the extra strength. If you have to do 3 servings on day 3 to get it to do what you want for you, you'll save a whole boatload of money by jumping up to the max strength, which is a 6x concentrate, and taking half the amount. So half of the 6x equals 3 of the original strength. So you really just have to start slow and low and build scientifically until you find what works best for you. It lasts for about 8 hours in the body, so there's basically 3 work shifts of how it can last for you. So if you want daytime relief, like construction workers use it, they take it during breakfast while they're at their job. Other people, they work all day, but then they want to feel better when they come home. They might take it in the afternoon or with dinner. And if you're taking it for sleep support, probably timing it at dinner is the best because you want to mix in with food, and it'll last probably until you go to bed to do so. The most advanced product that I just created is the water-soluble nano-emulsified, advanced absorption potential, and you don't need to time it with food. It's really cool. I already talked about that one. Already talked about that one. Already talked about that one. And I'm behind, as you can tell. Okay, so the final take-home is how does our product compare to the rest? To boil it down as simply as possible, we think it's higher quality because we use 100% certified organic Colorado-grown hemp and other high-quality ingredients. Number 2, it's more potent and concentrated than our top-selling brands. 3, it's a better value because it costs less per milligram than other brands. And third-party testing by independent lab confirms the quality of the product, so we're willing to be transparent with it. So if we can create a higher quality product that's more potent for less money, and we got the scientific evidence to prove it, for me, it's the easiest sales pitch of most things I sell. Okay, thank you everybody very much. I really appreciate the opportunity. Congratulations on 25 years at this place. For this community, I'm sure it's been incredibly helpful to have really authentic people who care about the health. All the products that they sell, I am big fans of. So they do a really, really good job of curating the selection that they have over there, and that you only get to that spot, that end result, in one way. You're authentic, you're real, you're doing it for the right reason, so congratulations.
Thank you.
Thank you, Abe.
Thank you. Do you have any brochures concerning the CBD oil or a website that we can visit to get more?
Yes, if you still have some of our trifolds, if you don't, I'll get you more.
Okay.
The website is hempluxe.com,
Okay,
hempluxe.com, and I'll give you a better one. If you just email mustardseedmarket.com, if you go to our website, there's an email us
Yes.
spot on our website. If you ask anything CBD related, I personally answer it. Mustardseedmarket.com. And if you email it, there's a generic email us thing. All the health questions go to me.
Okay, thank you.
Yeah.
That's how you order them through the email
You can purchase them right there.
Okay.
Yep.
The nanoparticle type of stuff you were just talking about right at the very end, does that mean that they're small enough that they don't have to go through the liver and absorb? Is that the issue about the nanoparticle stuff? And is that a better way of getting best absorption?
Yeah, I'll show you real quick. Okay, so the oil particle sizes are about 1,000 nanometers wide. They're relatively large, and it moves slowly through the body because they're so big. The industry average water soluble is 200 nanometers, and that is at the micron level. And ours is at between 20 and 30 nanometers, which is at the nano level. So going from 1,000 nanometers down to 30 is exponentially smaller, and so therefore it's able to travel throughout the body very easily. All CBD is fat soluble by nature. We have a fancy patent pending process to, as we made it super small, we then encapsulate it with a water soluble barrier. So therefore you can put it inside of any water-based beverage, which is inside of my water bottle right now. And you can take it on the go. And you don't need to time it with food. You can do it on an empty stomach and it absorbs just like you're drinking liquids.
And that's still extracted by the same...
Yeah, we take our same extract and then we put it through a second process. Again, we have a PhD chemical engineer who has a patent pending process that I found. Literally, he came into our supplement aisle asking our supplement people questions that are over their head, and that's when they got me, and we had a 2-hour conversation in the supplement aisle that turned into a partnership. So sometimes things like that are funny and happen like that. Yep, for sure. Any other questions?
Yes.
Yeah.
I just started using it for my knee,
Okay.
and then I found out the other benefits. And I think I need to move up because sleep is one of them.
Okay.
You know? Okay. I'm using the oil on the knee. I heard that the more you use it, it'll build up in your system. Or should I just go up a dosage once this is gone?
Yes, it's fat soluble, so you can you can accumulate, but that's usually when you ingest it. It happens a lot less when it's topical, just because it stays in that local cannabinoid receptor site area, and it's through the skin to do that. And so I'm not afraid to add more if I want more effect. Again, I can't tell you what to do, but the best thing I can say for you is that I have a high confidence level in its safety and its efficacy. So oftentimes people who want it to do more for you, most often just need to adjust how they consume it.
Okay, and number 2, would you recommend a salve or the drops?
Both. So I start off with the drops ingesting as step 1 because I want to get nourish my endocannabinoid system, because even if I don't have chronic pain or sleep problems or anything like that, it helps fortify. It's the nutrients that help fortify our endocannabinoid system. There's actually a medical term called cannabinoid deficiency, and because cannabinoids have been essentially outlawed historically in America and demonized, there's actually cannabinoid deficiency that's widespread for people who don't meditate, exercise, produce those endocannabinoids from within, or get it from phytocannabinoids from plant source. Yeah? Any other questions? Well, thank you. This is my first masked lecture. But in all seriousness, thank you, everybody. Have a great rest of your educational adventure today.
Okay, well, I will introduce our daughter Ashley Suzelis with Forest of Youth Health Spa across the street. She's a holistic esthetician, and she's going to have your attention for the next 40-45 minutes. Thanks.
Hi, thank you for joining today. So I'm Ashley Suzelis. I'm a licensed esthetician, and I specialize in holistic skincare. So I opened up Forest of Youth here in Newton Falls, and so I could provide wonderful treatments for people. So let me just go through here. Just wanted to give a little history of Forest of Youth. So I actually dreamt it up in 2011 when I was at school for osteology science at Aveda in Austintown. And we had a school project at the end of our class there. And so I had to come up with a business plan. And I just had this wonderful vision that I couldn't let go of. So that's kind of where it started. So I first rented a room in downtown Kent in 2013. That's where I first opened. That didn't last too long because I ended up being able to come and move over here in 2014 in Newton Falls here and open up with my mother, Synthia Suzelis, and also right next here, door to Healthy Chargers here. I became a member of the Holistic Association of Holistic Skincare Practitioners in 2014 also. And since then, I've been learning with amazing people, doctors, naturopaths, herbalists, Reiki masters, just across the board, wonderful healers, giving wonderful insights and information on all aspects of holistic skincare. So I continue to learn with them every year. And I also, last year, was a recipient of an award through the association there. I won an award for the most innovative holistic skin and body, most innovative holistic face and body spa. That's what it was for in 2019. So I opened it as a place for people who have chemical sensitivities. People without chemical sensitivities can also come. But I wanted to have a safe place for people to come and receive spa treatments, beauty treatments in a very safe way. And also to be able to educate about holistic skincare, healthy beauty ritual, and help to educate people to hopefully get to a place of healthy self-esteem. So what is holistic aesthetics, you might ask? So it refers to the treatment of skincare as one aspect of the whole well-being of a person. So it's just one specific little snapshot. But everything else plays into it also. I assess the concerns and needs of my clients based on, a whole body perspective, and it includes physical, emotional, and spiritual elements. And I only use ingredients and products that are safe and healthy for the body at large and beneficial for the skin. I also aim to be eco-conscious, so I try to be eco-conscious in every aspect of how I operate my business. And I also donate to an organization called Tree Sisters. They're a wonderful organization based out of the UK, and they help to plant trees along the equator where it's most needed for offsetting the carbon footprint. So I am not a doctor, and please refer to your doctor for any medical advice. I just want to say that. So why did I want to talk about skincare and hormones today? It's a topic that people, know they're connected, but don't really know exactly how. It's very complicated, so I'm going to try to break it down in as an easy way as possible. It's very complicated though, so we'll kind of just skirt around a little bit. So I wanted to introduce this topic today because personally I've had a lot of health scares myself, mostly due to hormonal imbalance, stress, injuries, and an irregular menstrual cycle. So I've witnessed many friends and clients also struggling in these ways, and I just want to learn more. I want to dive in deeper. I want to get into the research. I want to learn more so that I can help myself and I can help my clients better. Again, I'm not a doctor. I don't know everything about this subject, so I'm just trying to learn and share the information that I think is really important. And any information shared is not meant to be taken as medical advice. So again, please refer to your doctor or healthcare provider before making any major lifestyle changes. So I want to talk about the skin basics, just to kind of give an overview of how the skin works. So we have the epidermis, which is the outer layer of the skin, and it's composed of several dead skin, several layers of dead skin. And so it acts as kind of a protective barrier. The dermis is right below it, which is also known as the true skin. That's where we get into like really growing the new cells and tissues that form skin. And then below that is the subcutaneous layer of fat that cushions and connective tissue also. So there is an immune function of the skin. The skin's primary jobs are absorption, secretion, and it provides a protective barrier, and it also regulates body temperature. So these are all very important jobs that the skin has. The skin is the largest organ and the body's first immune defense. I think that sometimes we know this, but we don't really take the time to think about all of the impacts that might have on us and how big of a role the skin is in overall health. The skin absorbs about 60% of what we put on it. So I like to look at skincare as a way to offer skin food to our skin, because it actually is absorbing and almost like eating what we're putting on it. So I like to look at it as, only providing nutrients that the body needs to really build healthy tissues and cells. Another interesting fact is that the skin is the last organ to receive any nutrients that you ingest internally. So that also makes a very good case for why proper skincare is so important. And as long as there is healthy skin, there is less chance of infection. So that's why people who have maybe too oily skin, that can cause some barrier problems. Too dry skin can cause barrier problems. So one of the things is trying to maintain a healthy barrier. Most of the immune system lives in the gut, but there is a connection between the gut and the skin very intimately. And so a lot of times when there's issues going on in the gut, they do manifest on the skin. So a lot of times whenever you hear people talk about skin issues, people do ask about the diet first, because it is very important. Langerhans cells in the skin fight infection and move microbes through the lymph vessels into the lymph nodes, where they can be destroyed. So that is another really important aspect of skin function and health, which is another reason to keep it nice and healthy and nourished and hydrated, so that these functions can work more properly. Lymphocytes are white blood cells, and they are found in the blood and lymphatic system, lymph vessels within the dermis. So that's the second layer of the skin, and so they're actually white blood cells in your dermis. So all of this is just to show a little bit more closely how the skin really does interface with our immune system and overall body of health. So the acid mantle is a really beautiful way that I like to see this protective barrier. It's called the acid mantle because it's actually a layer of sweat and sebum. It is secreted by the sebaceous glands. There's generally, slightly acidic between 4.5 and 6.2 pH. So that's generally pretty healthy. And this acid mantle is a natural barrier to bacteria, viruses, foreign particles, maybe chemicals in the air, environmental toxins, and it also keeps moisture in, foreign particles out. So it is really important to keep a nice, healthy, protective barrier so that you can avoid unnecessary interfacing with infections or bacteria, viruses, things that you don't want to enter into your bloodstream. I wanted to talk a little bit about the toxic burden of skincare. So toxic burden is referred to usually as the overall accumulation of toxins in the body, but there is a toxic burden of skincare. Most over-the-counter skincare sold contains toxic ingredients, and these toxic ingredients can get stored in fat cells because that's what our body does when it doesn't know what to do with things and it can't detoxify them properly. So it puts them in our fat cells and they can overload the liver, causing a backup in detoxification pathways. This can contribute to infertility, obesity, diabetes, cancer, and autoimmune disorders. It is estimated that women absorb up to 5 pounds of chemicals through their skin annually. Every single year, 5 pounds, imagine taking all that on. And that's stuff that your body doesn't know what to do with it. So it's going to go somewhere, and that's why sometimes it has been shown to contribute to obesity, because if your body isn't able to detoxify it or get rid of it, then it's going to get stored in different places. Chemicals in skincare have not been regulated since 1938. That's almost 100 years. This is crazy, right? This is actually by the FDA. A cosmetic manufacturer may use almost any raw material as a cosmetic ingredient and market the product without an approval from the FDA. So this is legal. This is, what is happening in our cosmetics. And I'm bringing all this up so that people know what they're getting into, because we aren't really taught these concerns here. The Environmental Working Group's Skin Deep states that 89% of ingredients used in personal care products have not been evaluated by anybody, really, by the Cosmetic Ingredient Review, the FDA, or any publicly accountable institutions. So that's what you can generally assume when you go into a drugstore and other places, that most of these products have not even been tested. Since 1938, only 9 chemicals have been banned from use in cosmetics. So you can imagine, since the Industrial Revolution, how many chemicals have been made and how many chemicals are continuously made to put into ingredients in our skincare and so many other products. So again, this is only just to shine a light on what's happening here. This isn't to promote fear or scare anybody. I really want to empower people with information. In 2017, the CDC updated their 4th National Report on Human Exposure to Environmental Chemicals, and they reported that the average person in the U.S. has about 212 chemicals in their blood and urine, and that is just existing as a human being here in the United States. So that's pretty incredible, and that's an accumulation of the skincare, environmental toxins, toxins from food, from water, pesticides, GMOs, all of this stuff accumulates and stays within our body. So the concern here is the toxic burden on the liver, specifically for skincare, and the chemicals in skincare that act like hormones and hormone messengers. So this is what I'm really keying in on here. I have, I would have to say, a decent amount of clients at this point who have been struggling with acne, and we've been getting a lot of progress in different ways, and sometimes I come up against different hurdles, and one of the things that I've been really noticing is that people who have been changing their diet and change their products and go along this path, they notice results, but then maybe there's a place where they're just not getting better. There's a certain kind of like plateau that happens. And from working with my mother, Synthia Suzelis, who does a different type of testing, she can actually find out how the detoxification pathways are working. So a lot of times I'll send my clients over to her who just aren't getting better, and a lot of times she is finding that there is impediments with their detoxification pathways. So that is something that I just want to address more. These are two great resources for anybody to have, safecosmetics.org. They also have an Instagram here that they keep up to date, which is pretty interesting. Lots of information. They're the ones who are actually fighting for the rights of consumers. And then you also have ewg.org Skin Deep. That's a great organization also. If you want to check out your skincare products, you can go to their website, enter it in there, and see if they have like a toxicology report on different products. So it'll show you whether they're generally safe with a low level of toxins or high levels of toxins, and you should obviously very much avoid them. So since we're talking about detoxification, hormones, skincare, can't not talk about the liver. It is such a huge, important part of all of this. The liver regulates the balance of hormones by transforming and detoxifying excess hormones in the body. So as you can see here with this little diagram, things enter into the body through the lungs, the skin, the gut, the intestines here, and everything goes into the liver to get processed at some point. And then toxins come out through the lungs, the skin, the digestion, and the kidneys. So, or the colon, yeah. So you can see that the liver is really just like such a powerhouse in this whole process here. So excess hormones along with poor nutritional choices can lead to a sluggish liver, which leads to half detoxified hormones being recirculated in the body, and that can lead to hormonal imbalance. And that's something that I feel like I see a lot with some of my clients who have these detoxification issues, is that, it seems like they have all these excess hormones in their body, and maybe they've taken Accutane in the past, and their bodies, their liver is just less able to really deal with all these toxins. So this is a very interesting part for me just to pay attention to, ask questions, and make note on. Again, I'm not a doctor, so I'm just asking the questions here. But also, we do know that coffee and alcohol are very heavy liver loaders. They make the liver work very hard and can take away from filtering other substances. So that's why a lot of times when I'm working with clients or anybody who's having issues with detoxification, it's suggested to stay away from coffee and alcohol. Maybe not for forever, but in the instance of really trying to heal the body and allow the liver to process things easier, cutting those things out does seem to really help a lot, especially with hormonal issues, when it comes to women specifically too. Eating plenty of cruciferous vegetables helps detoxify excess estrogen, which is really important in all of this, for women specifically, and men, but cruciferous vegetables, that's so hard to say with the mask on. They're really great for helping aid the liver in the detoxification pathways. So, and then avoiding plastics also helps to reduce exposure to harmful xenoestrogens that mimic estrogen in the body. So avoiding any kind of plastics that you possibly can. Something that I think is so fascinating is I don't really think that people realize the impact that plastics have on our lives and how these parabens and plastics can get into our bodies. Part of it is through skincare, the parabens, to avoid. But then, if anybody is putting leftovers in a plastic Tupperware and you put that in the microwave, you are actually releasing harmful chemicals into your food before you eat it. So that's something to pay attention to. Try to really avoid using the microwave, but especially avoid it with plastic. Do not put plastic food in the microwave. And then, plastic water bottles, that's another thing. Keeping water out in the car or where it's hot, that's actually going to heat up those plastics, and that's going to leach into your water. So try to avoid that also. There's so many different ways, but those are just a couple of ways that you can take those things out of the equation for you. And then rosemary and turmeric have been shown to flush excess hormones from the liver. So, adding rosemary and turmeric to your diet daily are really great ways to just help assist this process. And this is just a little diagram to show you that there are 2 phases to liver detoxification. It's complicated. And I really highly suggest that nobody try to do a liver detox on their own. It's an important thing to do if you have issues with detoxification, but you want to find a qualified nutritionist, healthcare provider, or doctor that can help you with a liver detox, because you could kind of hurt yourself if you're not doing it properly. So this is just to show you that there are actually 2 phases to this, and if you're not doing it properly, you could kind of screw things up a little bit. So I want to talk about endocrine disruptors. Woohoo! Many toxic ingredients in personal care products behave as hormones and or hormone messengers. And I've stated this already, but I want to state it again and again. And they're called endocrine disruptors because they interfere with or disrupt our hormones. So maybe our own personal hormone production, or maybe these toxic ingredients are acting like hormones and they're binding to sites. So our body thinks that we already have enough of that, and so we're not producing, or we have excess produced. So there's so many ways that this can happen. Parabens are chemical preservatives used in personal care products to prevent bacterial growth, but they have very strong estrogenic properties that can mimic our naturally occurring estrogen. And this is why people suggest staying away from parabens so much. They have been shown to increase the risk of breast cancer. And parabens are in a lot of over-the-counter beauty products still, so just be very aware. In one study, parabens were found in 99% of breast cancer tissue. So there's definitely evidence suggesting that these really do interfere with our own hormone regulations and contributing to cancer here. So phthalates are also hormone disruptors that mimic naturally occurring hormones, and they can increase the risk of breast cancer also. They're toxic to the reproductive system, and they also promote obesity. And another study shows that phthalates are in 75% of cosmetics, and they aren't even on the label. So this is why it's really important to do your own research, do your homework, read the labels. Don't just buy something because it's cheap. It's really not going to do you any favors. A 2009 study in toxicology found that glyphosate-based herbicides are toxic and endocrine disruptors as well. And so I want to put that out there, just showing that even if you do choose more natural products, make sure that they are grown without pesticides, because that is another way that these endocrine disruptors can come into our bodies, and that's through skincare, but then also obviously food. And actually, I'm so sensitive to glyphosate, I can drive by somebody with my windows up in my car, and they'll be spraying it in their driveway, and my lips will turn numb. So I'm super sensitive to it, but it just shows you, it is really kind of a nasty chemical, and it can permeate so many different areas of our lives. This is a subject that I love to talk about, and people hate to hear about it, because I'm going to try to get you to stop wearing fragrance altogether. Fragrance is also known as perfume, and you'll see it on the label either as fragrance or perfume. It's a term used on the label of personal care products, many times to mask the smell of the ingredients that are in the product itself. And fragrance can contain up to 200 chemicals. They don't have to be on the label at all. They're known as a trade secret. So it's perfectly legal for them not to put any of these ingredients on there. But up to 200 ingredients, up to 200 chemicals that are made in a lab, that are put into a tiny little place on your products here. Many of these have endocrine disruptors in them. So I personally, whenever I see something with fragrance or perfume in it, I don't buy it. I just like put it right down. Even if most of the ingredients are amazing, if it has fragrance or perfume, I know that there's a high likelihood that I'm going to have some sort of reaction to it, some sort of allergic reaction, because I am very chemically sensitive myself. When a product is labeled unscented, that doesn't mean that there's no fragrance in it. That actually can mean that maybe there's a fragrance made to make it smell unscented. So look on the label, check your labels. There's really crafty ways to get around all these things. Fragrance chemicals also don't biodegrade. This is something that's close to my heart, as I am very much a steward of the earth. And you know, these fragrance chemicals, they get flushed down in our drains, go into our public waterways. They've actually been found in the ocean. There have been many studies done on aquatic life and how these chemicals, specifically fragrance chemicals, interact with aquatic life and cause infertility and different reproductive issues. So that's something I like to think about too, as far as not wearing fragrance. Like, yeah, I'm helping myself, but I'm also helping, you know, a larger picture too here. So if you have hormonal acne or you know, any kind of acne really, any kind of hormonal issues, do not wear fragrance. Do not put anything on with fragrance. If you get presents from Bath and Body Works, I don't know if there's a way to return them or gift them to somebody else, but you know, really try to avoid using them. Essential oils are wonderful if you really need to have a nice smell, nice pleasant smell. I mean, you know, who doesn't like that? It's nice to smell good. It's nice to have pleasant smells around. Essential oils can be very safe to use for fragrance, as long as they are from a trusted source. So there are a lot of essential oils out there that are adulterated. So make sure if you are choosing essential oils, you're getting them from a trusted source that does source them ethically and also organically if possible. And they also need to be properly diluted also. So the only essential oil that's really safe to put on the skin neat is tea tree. So most others must be diluted. So just keep that in your awareness. And I just love this picture here. I found this online, but I think I want to post it everywhere because public health warning: chemical fragrances pollute the air, our water, our ecosystem, and cause serious harm to pets, wildlife, and humans. So, you know, it's not just about us, it's about the whole picture here. And, you know, you see here this cute little family, pregnant mama with their dog, you know, surrounded by all these chemicals in their lives. You know, so many different ways that fragrances can enter our lives. So these are different things to look at home. If you're going through and trying to maybe clear out, come to a better, a healthier place in your lifestyle, these are all things to look at and sort through. And then the scientific research links fragrance ingredients, again, to diabetes, obesity, thyroid disease, low sperm count, early puberty, cancer, neurotoxic effects, asthma, migraines, allergies, and mild to life-threatening symptoms in people with chemical injury. So this is some serious stuff. This isn't just something to blow off. And then here's a whole host of ingredients to avoid. If anybody wants, I can always make print-offs. But a lot of these, you know, stuff that you don't really know how to pronounce, you're like, where does that even come from? Yeah, some of these are things you really want to avoid in your skincare products altogether. So I want to talk about stress. Because, man, this is probably one of the I would have to say like biggest health crises in the United States. I really do believe that stress contributes to most disease, more than we even realize. And as I was going through the study and research and just diving in a bit more with trying to understand female hormones in general, and then the skin and how it all interplays together, you know, stress is just such a huge component to all this. The stress hormone cortisol is released even with just a perception of danger. So literally, you could be sitting on your couch at home all comfy and think of something, you know, or like have an image shown to you or something, and that just sets off a whole host of things. You know, your cortisol is released, your adrenaline, and everything just starts to go in this geared up loop here. So if we're in this state in a prolonged time, increased cortisol can actually steal progesterone from the body. So for women, this is really important because progesterone should be very high in the last phase of our menstrual cycle to have a healthy, normal cycle. So if somebody is in a state of constant stress, your cortisol is being released, you're probably not producing enough progesterone. And progesterone is a beautiful hormone that helps us feel better, that helps us feel good. So this can actually lead to increase in irritability and an increase in inflammation in the body. So, you know, just that one perception of danger can set off this whole host of other things to happen. So in excess, the stress hormone cortisol can break down collagen and in the skin, leaving it thinner, less elastic, and more prone to premature aging. So that's another important reason to pay attention to stress and hopefully reducing stress, because who doesn't want to age more gracefully? Cortisol also increases blood glucose and so over time it can lead to insulin resistance, which is type 2 diabetes. And this is something that I've been learning more and more about, PCOS, which is a very common issue now amongst women. And so, yeah, this is something very important to pay attention to, because, you know, this whole thing can then interrupt your blood sugar, which, you know, then there's just so much to all this. It all interacts in some way here. Excess cortisol prompts the skin to produce excess sebum, which can lead to an increase in acne also. So especially teenagers who are going through like puberty, or just, you know, being a teenager is stressful in general, you know, and then you have all that excess stress and producing more and more sebum, and poor kids, you know, their faces are all shiny and they're all broke out and feeling all self-conscious, and, you know, that leads to more stress, you know, and then it just goes on and on and on. I was there once. Sucks. Recent research has confirmed that the skin, as an immediate stress perceiver and as a target of stress responses. I just thought that was interesting information, you know, just to see how, you know, how sensitive we really are to stress, to stressors, and our skin interfaces with that too. Excess cortisol in the body is also linked to obesity and adrenal fatigue, contributing to a sluggish immune system and impaired cognitive function. So a lot of times when people are overly stressed, you'll notice that they stop thinking clearly, that, you know, just everything kind of seems just overwhelming, and people can literally kind of shut down. And this is where we get to this adrenal dysrhythmia, as if this stress response is just over and over again. Then we can actually come to this place where our adrenals aren't functioning properly because they've been overstimulated for so long. And I thought this was really interesting. I heard this from a presentation a couple weeks ago, that your adrenals can actually be reset by camping for 3 to 4 days. So if you do think that you have problems with excess stress or you know, adrenal dysfunction, maybe take a nice long weekend, go get a cabin, turn off your phone, don't check your social media, you know, sleep out under the stars if you can, be in nature, and that really does help to reset our system. And yeah, so that leads me to talking about how we can counteract the effects of some of these things. And so this is just, for a healthy lifestyle in general. When we feel good, we can, walk a little bit more easily. Going hiking is really enjoyable, and we're getting so many benefits for our body, our minds, our spirits, participating in these wonderful activities, stretching, yoga, dancing, meditation, prayer, ritual, journaling. All these are different ways that we can counteract the effects of the stress and hopefully help to take a little bit of the burden off of our bodies, our systems, and our liver. Because it's up to us, guys. Nobody's going to do it for you. So then body work is another wonderful way to help get your body to a state of rest and recovery. Because you can't really, your body can't go into a state of recovery unless it is relaxed, unless your body is in a relaxed state or even sleeping. So that's why massage, myofascial, facials, acupuncture, all these things are wonderful ways to tap into the body's natural innate healing system so that all these functions and systems of the body start to regulate, start to tone down, start to, just function a little bit easier. So when we talk about hormones, nutrition always comes up, and skincare of nutrition always comes up because it's so important. Nutrition seems to be one of the most effective ways to balance hormones from all the research that I've been doing. One of the cookbooks that I came across that came highly recommended is Cooking for Hormone Balance by Magdalena. I don't know how to say her last name. I'm not even going to try. But finding a trusted nutritionist to work with to maybe get some recipes for hormone balance is a good way to start with that. I'm not a nutritionist, so I can't really offer nutritional advice to my clients, but I can say that when I see my clients taking action to clean up their diet and even reaching out to different nutritionists for extra support, they see a lot more beneficial results. Amino acids from proteins help the liver function and detoxification. So I just want to bring that up because I do have a lot of clients that are vegan and vegetarian, which there's nothing wrong with that. It's just really hard to do properly. I feel like you need guidance to get the right amount of amino acids and proteins in your diet, because amino acids and proteins are extremely important for so many bodily systems, especially skin function, building collagen, and helping the liver function properly. So generally, cutting out high inflammatory foods such as sugar, dairy, processed foods, fried foods can help regulate hormones just by eating really good foods. Eating regular balanced meals full of whole foods from organic sources helps the body supply the body with the proper nutrients it needs, because if our body is going to operate properly, there's so many functions going on. We can't just starve ourselves. We have to eat. But we want to make sure that we're feeding ourselves with as many nutrient-dense foods, superfoods that we possibly can, foods that are rich in antioxidants, all of these things that are going to help our body function better, help our skin glow, help our liver be more healthy, and just help us feel better in general. So I always love this: let food be thy medicine and medicine be thy food. That will never go out of style. Thank you, Hippocrates. And I love putting this up here because water is life, right? And this is a picture from Dr. Emoto's studies on water, if anybody knows anything about him. I don't remember exactly how this all worked, but I know that they took different water crystals or different bodies of water, and they infused them with specific emotions like love, gratitude, and then there's like hatred, disgust, all these different emotions, and then they were able to somehow, I don't remember exactly how this works.
They would freeze it.
They would freeze it?
they would freeze the water while the people were in the room. And if somebody had hatred towards the other person, then the crystals would come out hideous.
Right.
If somebody had love towards the other person, they would come out like Frosty the Snowman.
Exactly.
What it showed is you affect your environment that you're in, and you also affect your health and what your body becomes inside by the type of life that you lead.
Absolutely.
That's what,
Yeah.
and that study's been done over and over and over and over.
Exactly. So I just love this example so much because I think it is such an important part of health and well-being, healthy skin, healthy hormones. Our bodies are mostly made out of water and function a lot on water. All these different processes that are going on in our body do need water. So it's important to be conscious about where our water comes from, how we drink it. I like to actually pray over my water. I like to infuse it with like loving, positive vibrations, because then I know that I'm actually ingesting that and I'm becoming a part of that, and then I'm able to put that out into the world. So maybe a little bit witchy, but I think it's pretty cool. And then clean filtered water. I would highly recommend nobody to drink tap water. We don't really know what's all in there. So if you can get filtered water, there are lots of like RO systems. You can get a jug and go fill it up for 25, 35 cents or something. That's going to be a lot better than tap water. If you do get reverse osmosis water, it's important to put some minerals back into it. So I always like to put some Himalayan pink salt, about 1/4 of a teaspoon into a gallon of water, usually helps to reconstitute it. And then also drinking a lot of herbal teas is really a wonderful way to get water into the body, but then also extra nutrients from whatever kind of herbal tea you're drinking. And talking about tea here, it's probably one of my favorite things on the planet. But yeah, teas can be beneficial to helping rid the body of excess toxins. So milk thistle, dandelion, burdock, those are 3 of my top go-tos as far as when I personally feel a little bit sluggish, or when I have clients come to me and I can see based on what I'm viewing with their skin that their liver needs a little bit of assistance. So these are wonderful teas to have around for everybody. Many teas are high in antioxidants, and that's something that we really want to get as many antioxidants into our bodies as possible, because it helps our bodies fight against free radicals, which can cause a lot of oxidative stress, which causes a whole host of issues. So taking time to slow down and drink a cup of tea is just such a nice thing to do anyways. Tulsi is probably one of my all-time favorite teas, along with rose and calendula. It really does just help to bring you down to earth. If you're sitting there with a hot cup of tea in your hand, there's just something very peaceful about that. So the menstrual cycle here, I just love this picture. I'm just like becoming more and more in love with pictures of the uterus. I don't know why. I just think it's so beautiful. These are topics that I think were so taboo for such a long period of time that women really were so out of touch and almost shamed, for having a period. So I just want to talk a little bit about it because our hormones do play a large part. When our hormones are out of balance, the menstrual cycle easily gets thrown off. So then a woman's whole life can get thrown into chaos, literally, just from that. So one of the wonderful things that I've been learning recently is about cycle syncing. And this is for people who are still bleeding. And so there are 4 phases to the menstrual cycle. And this woman, Elisa Vitti, she wrote the book, Woman's Code. Highly recommend everybody purchase that if you're a woman who's bleeding specifically. And she does detail specifics in activities and foods, nutrients, different things to do during these different phases to help balance your hormones better. And then another thing that I've found more and more, I'm trying to integrate this into my lifestyle, is following the natural feminine rhythms, which is very different from our, patriarchal system of get up and go every day, be the same every day, have the same energy output. Women, we weren't made that way. It's really hard to function that way without becoming sick. So I took this course called Womb Wisdom by this beautiful woman, Usha Nandi, and she was one of my yoga instructors in Costa Rica. And she has studied around the world with different elders in different communities, specifically for women's healing and women's wisdom. And so she came out with this course. It's an online course. I took it, highly recommend it. It's wonderful information. So anybody who wants to know more about their cycle and also how to balance, highly recommend that course. And then also was one thing that I've noticed for having a healthier, easier menstrual cycle is a week before bleeding, start cutting out coffee, alcohol, the heavy liver loaders, right? And start eating dark leafy greens and cruciferous vegetables. Everything to help the liver, process the hormones better, and it'll help your body just to have a lot easier period. And this is a beautiful chart here just showing the hormone levels during a healthy woman's 28-day cycle. That's, normal healthy. So just showing the different ways that these hormones interact and how important it is to really keep them on track. Because if you say, like somebody who has PCOS, maybe they aren't producing enough progesterone, or maybe they are too stressed out and their cortisol is stealing progesterone, they might come to a place where, they're not able to ovulate. So there are so many different factors when it comes with hormones and all of these pieces interconnected. I just wanted to put this up here as a visual to show how intricate this whole system is. So I want to just talk a moment on birth control. Out of the 100 million women, almost 11 million in the United States alone who are on the pill, roughly 80% of them take it for non-contraceptive reasons like painful periods, endometriosis, PCOS, and acne. So I think that this is just a very interesting snapshot into what's going on in our culture right now. That we're using synthetic hormones, birth control to control menstrual cycles basically, and things that happen out of hormone imbalance. So I'm glad that people like Dr. Jolene Brighton are doing more research on this and bringing it to the public. Highly recommend that book, Beyond the Pill. And when on birth control, a woman doesn't ovulate. And the ovaries actually can shrink up to 47%. So when a woman's on birth control, her ovaries can be like a post-menopausal woman. That's just kind of bizarre to think about. Some of the side effects of stopping birth control are heavier periods, cramping during ovulation, PMS, weight changes, acne, and unwanted hair growth. So this is why a lot of people will just stay on it, or they'll try to go off of it, and then they have these symptoms, and then they're just discouraged, so they get back on it. And unfortunately, acne can be common for up to 6 months after a person gets off the pill, and longer for people who have detoxification issues. So, if you are somebody who wants to stop birth control because you realize it's just not what your body really needs, there's a lot of resources out there, and you can always contact me, and I will link you up with some different resources to try for that. So we can't talk about hormones without talking about sleep, because sleep is essential for the regulation and metabolism of several different hormones, especially melatonin and cortisol. So we have to sleep. If you're just running on, from the Kindle, burning the candle at both ends all the time, it's not gonna do you any good for your hormones. And getting at least 7 hours of sleep at night is key for this process. And in Ayurveda, it's suggested to go to sleep by 10 to get optimal hormone and digestive regulation. So I think that's hard for a lot of people in our culture, but just trying to make a conscious effort as much as possible without stress getting in the way is going to be really important. So in doing this research, I found that balancing hormones is best managed through nutrition, stress reduction, tapping into the natural feminine rhythms for women who are bleeding, and then using non-toxic personal care products. So these are all ways that we can actually empower ourselves to help regulate our hormones. And then obviously if you have deeper issues, work with your doctor, healthcare provider, and hopefully you can help sort those issues out a little easier. So one of the principles of Ayurvedic medicine, which is a 5,000-year science of longevity, is that health is an ongoing process. And a perfect health is defined as a balance between the body, mind, spirit, and social well-being. So I always like to put this up because it does come back to all of us. Health is an ongoing process. So we wake up every morning and we're the only ones who are in touch with our bodies, who can say, how am I feeling today? I feel thirsty. Maybe I need to drink some water when I get up instead of slam some coffee and run off to work, I feel a little bit weird in my back. Maybe I should get up and stretch, Instead of having somebody else tell you what to do for your body, it's really important to take ownership and to start to empower yourself with these different tools that you can utilize to help your body function better. And I just want to say thank you for coming. And I hope this was informational for you. I hope you learned something. And I'm sorry I don't know everything about this topic, but I'm going to continue learning because I'm really dedicated to helping learn more for myself and my clients. So hopefully I will have more information later on. And
Any questions?
yeah, is there any questions? Yeah.
I just wanted to know what you said you put in the water for the osmosis. I didn't write. We have osmosis system.
Oh,
for the nutrients.
Yeah. So I just I just put like 1/4 a teaspoon of pink Himalayan salt in a gallon of water, and that seems to be good.
Even to pure distilled water,
And distilled water.
the same thing.
Oh, well, distilled water is kind of dead water, so.
Yeah, there's nothing in that.
Yeah. Spring water is the best water to really drink. But distilled water, I don't, it's, if you don't have anything else to drink, that's okay.
Where do you get spring water?
There's places all over the country. There's a website called findaspring.com, and you can look it up and find springs. There's actually one in Chagrin Falls, and you can go fill up your water jugs and pay like 25 cents or something.
Oh my goodness. There's a place in Ritztown that'll deliver it to your house.
There you go. Place in Ritztown. Awesome.
I can give you the name.
Thank you.
And if you have an RO system, some of the RO systems have cartridges or whatever with the filters that actually add minerals back into the water after it goes through the filtration system. You can put it on afterwards and add minerals back in.
So yeah, if there's no more questions, thank you. If anybody wants to contact me, please find me. And yeah, hope you all have a wonderful day.
Thank you.
Okay. Hey everyone, this is Blake Suzelis here. I just want to wish you guys happy, healthy Treasures Health Day. And congratulations to Healthy Treasures on 25 years of business. And lastly, thank you to all of you who have supported them through all these years and fires and COVID and everything else that's been happening, so many things. So thank you guys all for just being there for Healthy Treasures all these years to allow it to be to the point where it is today. Well, I wanted to just let you guys know, January 2nd, I'm going to be coming back into town, into Ohio, and I'm offering a group hypnosis and or a trauma release workshop. And I just want to let you guys know that that's coming up. The group hypnosis session, that's something where I'm going to be talking about what clinical hypnosis is. I'll actually walk you guys through what trance is, and actually help you understand what self-hypnosis is and how you can take that away use it for the rest of your life. The trauma release workshop is something that's going to be a 3-hour deal. Just come, it's going to be comfortable clothes, bring a pillow, a blanket, a journal, and we're just going to kind of dig deep into releasing some of these things that have been maybe holding you back in terms of being who the person you want to be. So if you guys are interested, please let someone know. I'll be back January 2nd, and I really hope to see some of you guys there. Have a great health day, everybody, and I look forward to seeing you then.
Hi, friends. Welcome to Healthy Treasures, your local neighborhood health food oasis. In Healthy Treasures, you will find a great selection of organic produce and groceries to fit a holistic lifestyle, including gluten-free and dairy-free. You'll also find a wide variety of supplements to assist with your immune health and just overall goodness. Folks, I just want to take a moment and kind of walk you through the store and just give you a brief overview of the things that we carry. You may have caught the produce in the first frames or the first shots, but we also have items for your four-legged furry friends, for the bodybuilders and those who are looking for additional protein in their diets. We also carry a really nice selection of homeopathic medications and remedies. A lot of them have been around for hundreds and hundreds of years. 2 different brands in that and a lot of different homeopathic treatments. We're going to move back this way and talk a little bit about the essential oils. We've got a little bit of scents for everyone, from single flowers to blends and carrier oils.
Cut.
So at Healthy Treasures, we have 4 beautiful, fully stocked cooler cases with produce, dairy-free as well as organic cheeses, a variety of different types of milk, oat milk, almond milk, and organic whole milk. So we do offer not just a dairy-free lifestyle, but we offer organic options for a regular dairy lifestyle as well. We have a nice variety of spelt breads and gluten-free breads. Some of these are baked very locally for us, which is something that's really important to us. And probably everyone's favorite cooler case is the bulk snack case. We have everything from almonds and dates and nuts and chocolate-covered delights as well. We also have 5 beautiful freezer cases full of quick grab and go, but we also have an amazing assortment of local fresh ground beef. This comes to us from Red Clover Farm, and it is whole ground cow, which is, my husband refers to it as a steak burger. We also have some meatless options for those that are either vegetarian or vegan, including the famous Beyond Beef brand as well. Every kind of frozen vegetable that you can buy in a traditional grocery store, you can buy here, and you can be guaranteed that it is organic and better for your health. And then my second favorite case is the dessert case. So just because you're leading a dairy-free, a gluten-free, or a healthier lifestyle doesn't mean that you can't enjoy your favorite dairy frozen treats as well. So 2020 has been filled with numerous challenges, including how to stay fit and healthy, and having to learn how to cook at home again. So at Healthy Treasures, we have an amazing selection of baking goods as well as bulk goods to help you live a better lifestyle. The nice thing about some of the baking goods is everything that you have ever used traditionally, you can replace it with something a little more holistic in your diet. We've got everything from an egg replacer to aluminum-free baking soda and baking powders, raw cane sugar. So a really nice way to kind of get back into old-style baking. And who doesn't love a great cup of tea or coffee to either start or end your day? Here at Healthy Treasures, we have an amazing selection of organic herbal teas as well as organic locally roasted coffees. So if caffeine or relaxation is what you need in your cup at any point in the day, we have that for you. But how do you keep your house clean? How do you disinfect your home? How do you clean your home? We have a complete selection of everything that you would ever need to clean your home in a cleaner, greener, and more holistic fashion, including disinfecting wipes. Did you know that you have everything to make a disinfectant right from Mother Nature? It doesn't have to be cooked up in a lab. So this little section is what I consider to be every girl or woman's dream. We have such an amazing selection of local handcrafted soaps, amazing lotions made with shea butter, and wonderful smells to slather on and make you feel pretty. Wonderful ways to wash your hair. So what most people don't consider is their everyday products are filled with, if you knew what, you wouldn't want to put it on your body. Your skin is the largest organ of your body. Everything that you put on it goes in it. So why not take the plunge and switch over to something that is straight from Mother Nature? So as we have moved through 2020, what I have noticed as we have dealt with COVID was, first, people were really concerned about immune support. And of course, that will always, always, always be important. But what we're seeing a lot of our customers ask for now is, how do I get a good night's sleep? I am so stressed out. What can I do to assist my body to do what it needs to do? And this is the area of the store where you would find a selection of melatonin and other herbal supports for a good night's sleep and to help you deal with the stress and anxiety that 2020 has been. At Healthy Treasures, we have made an effort to make sure that we take care of everyone in the family. We discussed that we've got some things for the pets. We literally have vitamins and mineral support from pre-birth all the way through menopause for women and beyond for men. For every area and every stage of your life, we offer a multivitamin that is geared towards where you are developmentally. And then, of course, we have an amazing full alphabetical list of all the amino acids and vitamins that you could ask for, literally from A to Z. So finding the proper supplementation is something that is really important to the mission of Healthy Treasures. Synthia Suzelis and her husband Ted have sourced some of the greatest vitamins and minerals that we can get, and we have a wide variety that is just strictly our brand, the Healthy Treasure brand, of all multivitamins and D, C's, and the like. This brand has been tried and true tested by the Suzelis.
Hello everybody, I'm Kyle White. I work in sales at Healthy Treasures, and I'm here to talk to you about treating yourself. We have plenty of candies everywhere, our dark chocolate ginger, to cranberries, to almonds, any dark chocolate that you can think of, we will definitely have it. And what's nice is there is no serving size on it, so a full bag could be your serving size. We also have protein bars as well, so that way you can grab something on the go, be able to eat, move on.
Talk. Cindy Suzelis. I think you probably all know who she is. I'll just let her go.
Hi, thanks for being here today and helping us celebrate our 25th anniversary at Healthy Treasures. My talk today is about healthy, holistic living, and I can't say that I'm that I'm somehow the perfect person to talk about it, but I've just been on that journey to try to live a more holistic lifestyle. And how it started was, and you probably heard the story a little bit here and there, but our third son Blake was born with multiple birth defects. And when he was, they did surgery, they did medications, and they found that he was a failure to thrive because of these birth defects. And through divine intervention, God led us to a group of doctors who helped us to understand what his body needed. And just through some simple techniques, he became a child that was thriving instead of a failure to thrive. And at that particular time, we started being able to look at all of the different areas of our lives that may have been a problem, because they said it was a problem with chromosomal damage because of chemicals in the environment. So at that time, we decided that we're going to really look at all of these aspects. So we looked at our water, we looked at our foods that we were eating, our lifestyles. And through that, and through a lot of different challenges that we've had as humans, I feel like that we have a little bit of an idea of what we can suggest for the future for many people. So what is a healthy holistic lifestyle? Basically, it's the realization that we're not just a body, that we are also, we have a mind that we can control, and that we have a spirit that connects us to our Creator and to our communities and everyone and everything around us. And you might think, well, that's kind of pie in the sky. Who knows if that even exists, that healthy, holistic lifestyle. But actually, we do have something to fall back on that understanding, and it's called the Blue Zones. And I don't know if anyone's heard of the Blue Zones, but they've been using holistic living for a long time. And there are basically 6 different locations around the planet, in Loma Linda, California, Nicoya, Costa Rica, Sardinia, Italy, Icaria, Greece, and Okinawa, Japan. These are places that speak different languages, have different food sources, all over the world, but they have some things in common. They are people who are noted as living longer, healthier lives than most of the other people on the planet. So when they started doing this research, they found out that there were certain 9 particular ingredients that all of these particular places had. And they call it the Blue Zone's Power of 9. I like to use this because it's already there. It's something that we can really look into and see how our lives compare. But in that pyramid shape, let me look at this up here. From the pyramid, you can see that, I can't see that. So, at the top of the pyramid, there are some things that actually we do know, that these people move naturally. They make daily physical activity an unavoidable part of their environment. It's like having a dog. I mean, you have to move if you have a dog. You've got to take them out to walk them or whatever. You don't want to park as close to some place as you possibly can to get there, because you need to let someone who can't walk as well, number one, have those places to begin with, but being able to incorporate exercise into all of our daily types of activities. And if you have a desk job like I have a lot of the time, that's a little bit more of a challenge too. You have to really want to put that activity into your life. So moving naturally, that's one of the body parts of this. And number 2 is that you have to have the right outlook in life. You need to know your purpose. And I think it was Mark Twain that said that there are 2 important days in a person's life. And one of them is the day they're born, of course. And the second one is the day they know why. When you have a purpose, the why of getting up every day, then when you get up in the morning, you feel like, I've got something to do today that it's for me to do. It doesn't have to be anything super special. It might be I have to get up and walk the dog. It might be that I have to get up and call my dear friend that's waiting for a call. But you have to have a purpose, because that's what really drives good health and humanity even. We need to downshift at times. We need to work less, and we need to be able to really look at life and God's creation and appreciate it. If we don't take that time, if we don't take those vacations, then that is another avenue that can cause stress in our lives. And as we know, stress can overwhelm our livers. It can create a lot of garbage in our brains, and so it's one of those things that we really need to consider. So one of the things that's really important to me, of course, is eating wisely, because that's one of the things that the people in the blue zones do. In the blue zones, they have a mantra basically where you eat to 80% of fullness. And in our American culture, we tend to, well, just going out to a restaurant, you know that particular portion that they give you is actually for 2 meals, maybe even 3 meals. So being able to eat a little bit less than what our culture suggests really makes us live longer, healthier lives. They've even done research on mice and on rats where they have done some kind of restriction on foods. And if they can restrict a food or the consumption of food 40%, they can actually rejuvenate cells quicker, and that these rats and these mice actually live longer. So there's a lot of importance that goes along with doing a somewhat of fasting. Of course, more vegetables, less meat, and less processed food. That's just really, I mean, that's something that we all, I think, know. That when it comes to processed foods, you're just adding chemicals and different things to your diet that your body just has to take more time to detoxify. And there's a little bit of a plant slant in these particular communities, meaning that they eat a lot more of their vegetables, fruits, and very little meats. As a matter of fact, the meats are just mostly for the seasoning. Excuse me. So when it comes to these kinds of places in our diet and our understanding, we want to have foods that are healthfully grown in good soil. And that's just what they do in the blue zones. They go and they gather their own greens from their environment and they mix it with beans, because greens and beans actually happens to be one of the main staples of all of these communities. They are in different parts of the world, but they all have different kinds of greens and they all have different kinds of beans. And so that's one of the main staples for a healthy diet too, just overall. And in particular, I like the glass of red wine each day. Except for Loma Linda, they're strictly alcohol free, but they drink a lot of teas. But almost every other community, they have a little bit of red wine, and they do it at moderation, of course. You can't save up your glasses of wine and just drink it all in one day. That's kind of counterproductive.
Just in case.
Oh, thank you.
Shouldn't have done that.
And then there is belonging. Belonging to a group that keeps you socially healthy, that holds you accountable for your life. I know that in the Amish community, which I'm very familiar with, everyone has to go to church. If you don't go to church, then you will have the people knocking at your door trying to find out why. Because they care about each other. They hold each other accountable for their spiritual growth, for their physical, for their mental growth. And it's kind of interesting, I did see some research recently that said if you go to church on a regular basis, and church meaning, you know, any kind of group that has a spiritual way, it's not any particular religion, they say you add over 3 years to your lifespan because you're with a healthy group of people that are considering the mind, the body, and the spirit. Although I've eaten a lot of bad food at churches.
Donuts.
And prioritize family. Being connected with your family, having good relationships with the people in your family, that's another thing that these people in the blue zones have in common. So those are really the power of 9. And if sometimes we want to know, well, you know, what is a spiritual imbalance? And a spiritual imbalance basically, this isn't all of them, but actually, if you're withholding forgiveness of yourself and others, if your true spiritual beliefs are at odds with your life choices, that can be a problem. Feeling a lack of gratitude and appreciation for life blessings and learning experiences. Neglecting your relationship with the divine, your higher self, or a power greater than yourself as you understand it. Having a victim mentality instead of embracing your role as a co-creator in your life. And refusing to engage with your life purpose. All of those could just be possible hints of a spiritual imbalance. And diet-wise, again, looking, you know, from the blue zones to our particular lives, we eat mindfully. If we do that, we don't just sit in front of the television and just eat, or go through a drive-through and just eat, you know, food. We really need to be appreciative of the food that we get, where it came from, the hands that prepared it, and all of that. And I'm one who really believes in eating organically and eat right for your blood type, because organically means that they did a study in Denmark. And they sampled the fat cells of a family of 4, mom and dad and 2 kids, and found that they were very toxic, the amount of toxins in their fat. So they went on, this was an experiment to see what an organic diet would do. And what it did was, actually, it helped to detoxify the cells in the bodies. So even just eating organically, it is important because you're not adding more toxins to your body, and you are actually helping your body to work better. And if eating right for your blood type, I'm not sure, has anybody not heard of Eat Right for Your Blood Type? It's basically, out of the 35 years that I've been a practitioner, it's the most important one that I've seen for people's health, because it is a diet that based on your blood type, helps to reduce inflammation in the body and helps increase beneficial influences in reducing inflammation. So if you're an O blood type, basically you're that high protein, low carbohydrate machine, and you really do really well when you eat like that. If you're a B, like I am, then you're more of an omnivore. You could go vegetarian, or you could eat meat. But chicken is like a toxic food to me. So that creates one of the most inflammation, as well as corn, as well as wheat, soy, and tomatoes. I hate to say that because I love tomatoes, but I always figure if we grow them in our own backyard and we just eat it for that time, then that's okay. The healthier you are, the better you're able to take advantage of these foods too. A blood types, I would say, O blood types are the number one amount of people in the whole world. A's are about half of little less than half, and A's tend to have more problems with meat, whereas the O blood types can handle meat much, much better. A's tend to get a lot more problems with their digestion and inflammation from the consumption of meat. And ABs are basically a combination between the A's and the B's. But if you're not familiar with it, you could just Google it, or we have some books, or find out what your blood type is, because it will give you some of the most important ways to what exercises are best for you, what foods are best for you, and all of that. And speaking of meat and the O blood types, the meat should only be a part of your healthy diet if the animal was humanely raised and if it was fed what it was meant to eat. And since we have an organic farm, I think we have the happiest cows around, and when they're ready to go, they're fine. This next one I think that we should always do is kind of retrain our taste buds, because I have so many people that will say to me, oh, I would eat more healthy food, but it doesn't taste good. Well, the thing is, since we were born, we were trained to see things that were dangerous. We were trained to see things that were beautiful. We were trained to hear for dangerous things, or listen for beautiful things, or informative things. Touch, we were always, educated about that. But taste, which is so important, those nerve endings are hardwired to the brain. That's one thing that we rarely have seen in our culture, as being trained to eat real foods. And I have one client who, she was totally addicted to milk chocolate. I mean, really bad. She would eat like blocks of it. And she hated the way she felt. She always had this mucus problem. She had terrible allergies and everything that went along with that, overweight. And I would talk to her over and over again about, reducing her milk products, her sugar products. And so finally I said, wait a minute, why don't you talk to your food? And she said, I said, well, you need to look at that piece of milk chocolate and say, yeah, you look good and you taste good for a little bit, but you feel terrible. And so she was getting some of that feedback. When it came out of her mouth, all of a sudden her brain was saying, oh yeah. And she says, but I hate dark chocolate. And I said, did you notice you said love with milk chocolate and you said hate with dark chocolate? I said, there's some emotions there that shouldn't be, associated with foods. I said, so since there is, maybe you ought to look at that dark chocolate and say, you are beautiful. You are dark, you're shiny, and I know you're really good for me. So after, she laughed at me before she left, but when she came back in about 3 months, she said, it took a while, she said, but I do eat dark chocolate now, and she says, and I avoid milk chocolate. But from the time we're little, we need to be fed or retrained to eat real foods, real tastes, because most people don't know that if they have scientists that are doctors of chemistry that actually make foods to addict your taste buds, so that they have just the right amount of salt, just the right amount of sugar, just the right amount of fat, and some artificial colorings and taste to make it so that you're so addicted that you can't not eat it, unless you're aware. So I'm a big fan of retraining your taste buds, and it takes a while. It's not something that comes naturally if you haven't. But the benefits, even the older you are, the benefits are really good for your health and your overall well-being even. So, and I did say about the greens and beans and moderate red wine, organic teas and coffee, because the coffees that are grown most of the places around the world, they're sprayed with pesticides that we've even banned in the United States. They pick it, grind it up, and send it right back to you. And organic coffees definitely are actually considered a health food if you're able to drink caffeine or have coffee. So when we're talking about the basics of holistic living, we're saying that eat well and organic, eat mindfully and only to 80% full, connect with the divine and its creation, learn to love and practice gratitude. Choose optimism, because this will direct your actions. And I think that probably everybody's heard that. It's easy to say and it's hard to do, but always looking at the bright side of things and searching out the good over the bad. And giving to others is truly giving to ourselves. And when you give to others your time, your treasure, your talent, those are the things that actually we give back so much more than we could ever give. And then always looking at the purpose. What is the purpose of this? What is my purpose in this? And look at it as an optimistic purpose. And sleep well, move naturally, have fun, learn new things. All of those are just, part of living a really important, happy life. And I kept this kind of short because we've had some people standing here or sitting here for such a long time. But what I would like to end with is, finally, my friends, whatever is true, whatever is honorable, whatever is just, whatever is lovely, whatever is gracious, if there is anything worthy of praise, meditate on these things. Then the Lord of peace will be with you. And this comes from Philippians 4, verse 8. So thank you again for coming today. And if you want more information about healthy holistic living, just let me know. So.
We will have a final drawing here in a minute, but she was talking about being optimistic. I have a little story to share with you. There was a set of twins, 2 boys. One was an optimist, one was a pessimist. So the scientists got a hold of them, wanted to do this experiment on them. They put the optimist in one room, put the pessimist in another room. They were just little kids. They filled the pessimist room with toys, anything the kid could want, games, toys, everything. The optimist room was full of horse manure. So they turned the kids loose in there, and they come back in an hour. The pessimist had broken all the things. He's just sitting there crying and complaining. Oh, this stuff is broken. I hate this stuff. Just typical pessimist. So they go to the optimist room. And here's this kid. He's digging, just smiling, laughing, digging, moving the poop from one side to the other side. But he's still happy. And they said, why are you so happy? He says, well, with all this horse manure in here, there's got to be a pony somewhere.
I'm Dr. Ted, and I'd like to talk to you today about the blood type diet. For those of you who are my patients or know me well, know that this is an integral part of my medical practice, that I really feel strongly about it for my patients. But I'd like to go a little bit deeper and help people understand a little bit more about why I recommend this diet and some of the results I've seen. So before I go into it, I really want to talk more about my personal experience with the diet. So I was exposed to this blood type diet in 1999 when I was about halfway through medical school. And at that point in time, I was getting really run down, having trouble keeping up with my classes. So I went to my school's medical clinic, and one of the doctors there had recommended that I try this blood type diet. And it sounded sort of hokey to me, but I really trusted the doctor, so I decided I'm going to give this a try. And so I worked really hard on my diet. I'm actually a blood type B, and so with that, some of the foods that I really had to avoid were things like wheat, corn, chicken, peanuts, tomatoes, a large portion of the conventional, normal American diet. But I did fine. I found good substitutes for the things that I was used to eating, and I started noticing some improvements. And after about 2 months, my wife had a company picnic. And I decided I'd been so good on my diet at that point that I'm just going to go enjoy myself and not bring special food or anything. And so I went, and the main food they had was from Subway. And so, those big, long 6-foot tubs. And so, did the best job I could. I got a turkey sub instead of the chicken because, like I said, chicken's not good for my blood type. But I got on a whole wheat roll because, whole wheat's supposed to be the healthiest for you. And so I ate my sub, and within 15 minutes, I was so exhausted that I could hardly keep my eyes open. I actually felt like I was drugged. And that was my first wake-up call as to, there's something to this diet. But at the time, I was 25 years old. I really didn't want to do all this stuff about this whole diet. So I decided I had a wheat allergy. Just have to stay away from the wheat, because I knew for sure that that was something that I specifically had trouble with. So that suited me well, because anytime I tried to have wheat after that, after giving it up for a while, I really had these bad reactions. But just giving up the wheat really didn't do everything I needed it to do. So I started playing with some of these other foods and found that, yeah, the wheat definitely really was an immediate drain of my energy and really made me feel horrible. But when I gave up corn again and added back in, I found out that the corn sort of affected my long-term energy, where I just didn't have the stamina that I normally would have. But I also got a lot of mucus in my throat and my sinuses when I'd have corn. And so I started playing with these different foods and found out how important this whole diet was to helping me to feel my best. And so that was my initial, exposure to this diet. And so once I started my practice in 2001, after I graduated medical school, I started recommending this diet to patients. And 2001, here in Northeast Ohio, I didn't really expect much, to be honest. I thought it was going to be really hard to talk people into changing their diets. But I found that I had a lot of patients that were really receptive to making those changes. And when people did make these changes, they really saw some good benefits. So that motivated me more to really trust this diet and to recommend it to other patients. Some of the different benefits and cases I've seen that are really amazing, probably one of the best is a gentleman. He was in his mid-50s. He had severe debilitating osteoarthritis in his knees, to the point where all of the COX-2 inhibitor drugs, which are special pain medications for the joint, for arthritis pains, until they found out that they cause heart damage, but all those drugs didn't touch his pain. Nothing else did. And I was sort of his last ditch effort before going and having bilateral knee replacement. So he's in his mid-50s. He's a roofing contractor nonetheless. So that was definitely not something that was ideal for him to have knee replacements. So he came to my office, we talked about it, found out that he was a blood type O. And he didn't want to really try any supplements or anything. He didn't, but I was able to talk him into doing some of this blood type O diet. And with that, I was able to have him give up wheat and dairy products. And he came back to me a month later and came walking in the office and he said, "I'm totally healed. I have no pain whatsoever in my knees." And then he backed up for a second. He's like, "Well, wait, I lied. About a week ago, I had a sandwich and I had some pain for a couple of days, but it's better again and I'm good." So I found that pretty amazing. And, I didn't need to see him in the office after that because he was doing really well. But about 10 years later, I saw his son. He came into the office and was able to actually update me on his father and found out that he still was doing really well, didn't have the knee pain as long as he followed his diet. And now I think it's probably been closer to 15 years and he's never had the knee surgery. He's still fairly pain-free as long as he follows that diet. So I found that to be a really compelling story. Obviously not everybody's going to get those same benefits, that same level of benefits, but I see a lot of benefits for different types of conditions. Another great example, I've had a lot of patients suffering from migraines. And seen major improvements with their migraines. In fact, one woman, she was in her late 20s and she was having daily debilitating migraines to the point where she had 2 children, I think they're like 3 and 4 years old, and when her husband went off to work in the morning, her 2 little kids were taking care of her. She was laying on this couch in pain and had no quality of life whatsoever. So she came into my office, we talked about this blood type diet, and found out that, that some of these foods that were wrong for her blood type were huge triggers. I believe she was a type O also, so wheat and dairy products were big triggers for her again. And she was totally pain-free after about a month of being on the diet. And then anytime she would cheat, she'd get a migraine. So I've had a lot of patients like that, with different types of pain issues that the blood type diet has made major improvements. I've had other patients with a wide variety of different health issues that have seen really nice benefits from the diet. And so here I'd like, after giving a couple little examples, I'd like to talk a little bit deeper about why I find this diet to be important for people. So like I said, when I was first exposed to the diet, I thought it sounded sort of hokey. Initially, I thought, well, what does your blood type in your blood have anything to do with the food you eat in the digestive tract? I didn't see where that connection was. But after doing a lot more research, I found out that that connection really has to do with your immune system. So conventionally, doctors look at those blood type markers, being little proteins on your blood cells, to differentiate your blood from foreign blood. So if you were to get a blood transfusion of the wrong blood, your immune system would see those foreign blood type markers as foreign invaders and attack them just like it would a virus or bacteria. And of course, they can be dangerous. Well, our immune system in the digestive tract works essentially the same way. And that means that we can eat certain foods that have proteins on them called lectins that actually look like the other blood types. So when you eat those foods, your immune system, which is just looking for foreign invaders, can misidentify those foods as foreign invaders, causing immune reactions in the digestive tract, which then can work into problems elsewhere in the body. So I find that this is just sort of a genetic marker to understand the foods you're most likely to do really well with and which ones you may have the most problems with. But I want to back up a little bit here after that explanation and talk about the big thing going on in our world right now, COVID. And I'm sure a lot of you have heard about, seen media reports that blood type O's seem to have the most protection from COVID. And you might think, well, why would that be? And it's funny because a lot of the people, these top doctors that are talking about this, they have no clue why. Yet every medical school teaches about the blood types and how different infections, people tend to have different reactions to these based on their blood types. So for instance, like I talked about the foods, we have little proteins on some of these foods called lectins that look like the other blood types. Well, it's the same thing with different viruses or bacteria, that you can have these little markers on these bugs, and so some blood types can see it really clearly as a foreign invader and attack it much more completely, much earlier, where other blood types may have a little more trouble identifying that that's a foreign invader. So that seems to be the case with COVID with blood type A's, and also AB would fall in there too because they still have a blood type A blood marker. And so they have a little more trouble seeing this virus as a foreign invader, which can allow things to ramp up a lot more quickly, where blood type O's tend to be the most resistant, and then blood type B's somewhere in the middle. So that gives you a little more information there. So from here, I guess I'd like to talk about a little bit about the four different blood types. So blood type O is the most common blood type in our country. It's about 45% of the population. And whether you're positive or negative, it really doesn't make a difference as far as the diet goes. So whether you're blood type O positive or O negative, it doesn't matter. You're still going to follow a blood type O diet. And blood type O's, you want to think of them more as a carnivore, more of a caveman type diet. Type O's do really well with most of your meats, lots of vegetables and fruits, but they have an awful lot of trouble with a lot of grains and dairy products. So with that, I tend to recommend my blood type O's when I first see them to really cut out the wheat, corn, and most dairy products. Those are some of the foods that I look at first to eliminate for the type O's to see how their bodies react. type A is the second most common blood type. It's about 40% of the population. So between O and A, it's most everybody, about 85% of the population. And type A is quite a bit different than the type O's because type A's have a much more trouble digesting and breaking down meats, especially red meat. And so with that, type A's, as far as meats go, you really want to stick with chicken and turkey, the poultry, and then lots of fish too. And type O, all the blood types, there's lots of different types of fish that they do well with. But type A's, definitely poultry is the only, meats you want to do. And still, again, there's lots of different vegetables and fruits and things. Type A's do a lot better with a lot of the grains than the blood type O's. And there's just little bit idiosyncrasies between those different blood types. Then we get to the blood type B, and it's a lot more rare, only about 11% of the population. So which means that type AB is only 4% of the population. So that last 15% of the population is sort of odd in that we have a lot of trouble with chicken. So you typically think of chicken as being, the healthiest meat, and for 85% of the population, it's very healthy, but this last 15%, not so much. But like I was telling in the beginning, when I started this diet, I'm a blood type B, and so when I'm working with patients, or just like myself, some of the things that I have to be most strict about are chicken, wheat, and corn. And so then when we get to the ABs, which is only 4% of the population, their diet is sort of a mix between some of the Bs and the As, where the type Bs actually do really well with dairy, type A's don't do so well with the dairy. So the ABs actually do well with a lot of that dairy products, just like the type Bs. The type ABs do a lot better with the grains than the blood type Bs. So there's always a give and a take between these different blood types. So that's really my basic, what I wanted to talk about today. Healthy Treasures here has a lot of good resources for you. If you don't know your blood type, they do have blood typing kits that you can get and find out your blood type. They have lots of books that you can learn about the blood type diet. They have a lot of foods that are geared towards the different blood types and to help people follow their diet and eliminate certain foods that might be causing problems. And then if you really want to get more into this, you can always contact me and schedule an appointment to really talk about how this could be a lot more of part of your health goals and working on getting your body healthier. Have a good day.